Yeah. Good morning, everyone. It's an honor to invite you. It's an honor today. I'm sorry. Today I prepared this presentation, so I think it is a little bit different introduction and my presentation topic. Okay.
Yes.
Okay. Yeah. So today I like to talk about the latest wound care techniques with the various types wound in the Korea.
Hello, Miss Wang.
Hello?
Okay, are you still
Okay.
there?
I'm
Sorry
sorry.
for the technical error. Sorry.
Yeah, I'm sorry. Yes, I will start again.
Yes, I'm
Okay.
sorry for the
I'm
technical
sorry.
error.
No. Okay. Oh, oh, oh. Okay. Can you see my presentation file?
Yes, I can see.
Okay. Okay, today I'd like to talk about the latest wound care techniques with various types of wound in the Korea. Okay, I will start. Today I prepared the contents like this. Before start the presentation, let me introduce myself. But
Yes, please.
I think moderator already introduced me. So yeah, it is skip. Yeah, despite skip because we need more time. Yeah. Okay. At first, I want to introduce the Korean Association of Undostomy Continence Nurse. KAWCN have been established in 2000. The actual members are about 600. Among them, about 100 nurses, WCN, WCN education program that be accredited by WCT. In Korea, there are two WCN education programs that be accredited by WCT. And KAWCN have an education program that modified WCT education program. So until now, KAWCN made a nursing standard associated with ostomy and continence nursing and developed education materials for ostomate. We continuously publish many books and materials associated with WC nursing for nurses. And we translated to Korean the NIAP, MPIAP, EPUAP, and PPPIA International Pressure Injury Guideline. Now we are included as the EPUAP members, and we participated as a small working group to revise the third edition published International Clinical Practice Guideline of Pressure Injury. Next, I introduce our hospital. I'm working at Assam Medical Center as a WCN. Assam Medical Center was established in 1989 It is the largest medical institution in Korea with a total of 2,715 beds. Asan Medical Center has 4,000 nurses and 120 nurses is working as a clinical nurse specialist. Asan Medical Center recently opened the Center for Infection Control, Korea's first among private hospitals, a freestanding building fully equipped with a negative pressure system. So this building have a ER, outpatient clinic, CT imaging lab, ward, operating room, and ICU, all in the one building. So the first proactive infection control model in Korea that can deal with the COVID-19 respiratory infection and imported infectious disease around the clock. In Asan Medical Center, four wound-ostomy continence nurses have worked associated with WC nursing as a clinical nurse specialist, educator, consultant, researcher, and administrator. The WCN plays a pivotal role about optimal patient care in Asan Medical Center. All WCNs in Asan Medical Center have been certified WCN education program in Emory University Hospital, in Cleveland Hospital in USA. Basically, medical staff consults WCN when their patients need the care of wound ostomy and continence. Asan Medical Center WCN provides direct care to patients with acute and chronic wounds, traumas and fistulas, pressure injuries and continence disorder, and participate in assessment, training, implementation, and evaluation of patients with WC care needs. We independently decide the plan and intervention associated with WC nursing. All medical staff respect and follow our recommendation and reply. Especially, we take care of all patients regardless of adults and pediatrics, and our hospital have a standard about the WC nursing as a job description. It guarantees WC nursing and role. We work in multiple healthcare settings, including inpatient and outpatient departments. We have an independent outpatient clinic where can apply to Menzi and educate associated WC nurse care. Especially, we have another special clinic. The clinic is included in Asan Medical Center Cancer Institute. The clinic is opened for only patients with malignancy wounds. This clinic protects private of patients with malignant wounds, and they are certified with this special clinic. We play as the educator for patients, students, staff nurses, and medical staff associated with WC nursing. We continuously develop a variety of education materials to share our knowledge and experiences. We have a variety of education materials that is made e-learning and video program, especially video program for ostomy patients and caregiver is accessed on YouTube by searching easily. To improve knowledge, ability, and practice of staff nurse, annually we manage wound ostomy champion nurse. Wound ostomy champion nurse does various activities in their unit. Their role is the primary care of wound ostomy nursing. It is possible because of active support of nursing department. Good performance of champion nurse is reflected their performance evaluation and the promotion. Also, to share a professional WC nursing with many nurses, we open a WC nursing education program once every year. Many nurses participate in this program, including other hospital nurses, and many other hospital nurses want to participate in our education program. Recently, we opened the WC nursing education program by online. Before start the program, we send the simulation package to participants, and then we show the practice about pouching, dressing application, and fistula care. Okay, I want to finish about us. From now on, I want to express the wound management and prophylactic dressing of the pressure injury in Korea. Yeah, we meet, as I mentioned, we meet the variety of wounds. We decide the plan and the intervention for effective wound management. I introduced several wound management methods and products that recently used in Korea. Yes, I think you know MPWT. Yeah, negative pressure wound therapy can be used for the management of a wide range of different wound types. Yeah. Modern wound healing techniques were not introduced until the 20th century. Russian researchers in the 1980s appeared to be the first to use negative pressure for wound treatment. In 1993, Germany reported the first clinical study about the MPWT. The commercialization of the modern MPWT system was first done by KCI in USA. Yeah, it is a vacuum system. Yeah, so it is the best. Therefore, currently 14 different manufacturers have commercialized the MPWT device, each providing different types of devices. The mechanism of the MPWT and key benefits are not now well established, but solid clinical evidence is still necessary. Experimental studies are currently underway to achieve a deeper understanding of the mechanism of action of MPWT and to further expand its clinical usage. Actions of MPWT are providing a physical barrier to external contamination, removing excess wound escape, facilitation of moist wound healing, wound contraction, reduction of edema, granules and tissue formation, angiogenesis, and improving of tissue formation. The recently type of MPWT is very various. Traditional MPWT is used for acute and chronic wounds. Recent progress in MPWT has been the development of single-use MPWT devices. Current practice consider prophylactic effectiveness of the cross-incisional MPWT system. Traditional MPWT system includes a canister for fluid collection from the wound. The pressure applied is adjustable with continuous and intermittent modes of operation possible. For special treatment requirements, MPWT can be used in combination with the wound cleansure or topical solution, so-called MPWT inspiration, predominantly for septic and contaminated wounds. Traditional, yeah. Yeah, some single-use MPWT devices are canister-free and hand fluid mainly through evaporation from the outer layer of the dressing, mainly suitable for low to moderate state levels. Single-use MPWT are recommended in cases when early hospital discharge is planned. Yeah, MPWT can be used as a prophylactic method for patients at high risk of surgical site infection and other surgical complications. Both traditional MPWT and single-use MPWT can be used as a cross-incision MPWT. Single-use MPWT is also increasingly being used as a cross-incision MPWT as a preventative for complications. It may also aid the healing by reducing lateral tension across the cross-incision, improving lymphatic drainage. But cross-incision MPWT, there are type of sponges, pressure level, and duration of MPWT also need to be clarified. Yeah, MPWT can be used for the management of a wide range of different wound types. And MPWT can be considered for wounds at every stage of healing. So MPWT has a role in the management of highly existing wounds that would require very frequent dressing change if managed conventionally. Management of wounds that are failing to heal despite optimal treatment and the exclusion of infection biofilm-related delayed healing. Management of cross-surgical incisions that are at high risk of surgical site complications. To effectively use the MPWT, we know the contraindications and cautions to the use of MPWT. If wounds have necrotic tissue or exposed blood vessels, we cannot use the MPWT. Today, there are no published recommendations in the literature about the best time point to start or stop MPWT. Additionally, there are no evidence-based time intervals specifying when MPWT should be changed after initial placement in such cases. However, manufacturers' instructions specify 48 to 72 hours between dressing changes. Nevertheless, based on the available experience, some published data and recommendation of manufacturers, it is possible to make a differentiation of the start and stop time point, duration of the therapy, and sensible dressing change intervals between the different purposes of the MPWT. Yes, a variety of factors should be taken into account when selecting an MPWT device for patients and wounds. Wound type is a more important factor than surgery type when considering when and which form of MPWT is appropriate, but the choice between traditional and single-use MPWT depends on the individual patient, the clinician's experience, and the local protocols. If switching between traditional MPWT and the single-use MPWT, wound and patient factors such as the patient's quality of life and should be considered. Practical tips that can have a positive impact of MPWC on patient outcomes are shown in this table. To relieve pain, turn off suction 5 to 10 minutes before dressing changing to reduce pressure and use an intermittent layer. To maintain dressing seal, use smaller parts of adhesive foil in complicated body contours and localize the part of the dressing at lowest part of the wound, especially oh my god, especially traditional MPWC. Yeah. Yeah, I'm sorry. Oh my god. Yeah. Can I understand why Caroline, additional Caroline? I don't know. Okay. Lunasys is the MPWC system that used commonly in Korea. It is combining portability and ease of operation to maximize the patient comfort, mobility, and convenience. The Lunasys Go offers the flexibility in treating a wide variety of wounds in acute and home care settings. And it is another MPW system in Korea. CuraVac and Curasys is another MPW system that used commonly in Korea. Especially CuraVac is developed by Korean company, so it is very commonly used a variety of healthcare settings. For wound healing, the complicated mechanism occurs in four phases: hemostasis, inflammation, proliferation, and maturation. Povidone-iodine used for several decades. Povidone-iodine has the broadcast spectrum of activity, persistent antimicrobial effect, an ability to penetrate the biofilm, and a lack of acquired or cross resistance. To effectively manage the wound, we have to keep the wound bed preparation concept. The time acronym consisting of tissue debridement, infection or inflammation, moisture balance, and edge effect has assisted clinicians systematically in wound assessment management. Recently, the concept of oxygenation and the biofilm-based wound care has been added to time concept. It means that infection and biofilm control is important for wound management. Biofilm-based wound care plays a key role in providing the proper environment in which tissue repair can take place, especially chronic wounds. So, so antiseptics for prophylactic. So antiseptics for prophylactic or therapeutic use, facilities for wound healing. You have to decide to use the antiseptics and antiseptic dressing products when you manage your patient's wound. Among of many antiseptics and antiseptic dressing in Korea, we usually use the povidone iodine and the povidone iodine content products. The microbicidal activity of iodine appears to involve the inhibition of vital bacterial cellular mechanisms and structure endocytes, nucleotide fatty amino acids in bacterial cell membranes, in addition to cytosolic enzymes involved in the respiratory chain, causing them to become denatured and deactivated. And povidone iodine have effects on biofilm. It inhibits the development of new biofilm, eradicates young biofilm colonies, and significantly reduce the many biofilm colonies. Beta-foam is a polyurethane foam dressing impregnated with 3% povidone iodine, which is safe the wound and effective infection control. Beta-foam is developed to overcome the limitation of current silver-containing foam dressing with reduced cost and cytotoxicity to host cell. Beta-foam is also developed by Korean company, and it is usually used in Korea. Beta-foam demonstrates the lowest cytotoxicity to fibroblasts. Re-epithelialization duration of beta-foam was shorter significantly than other dressings. So it is usually used in Korea. Maybe rest topic. Yeah. So recent international pressure injury guidelines recommend the prophylactic dressing for sacrum and heel. Especially, they suggest the multi-layered foam dressing to protect the skin from pressure injury. So in Korea, especially in our hospital, we use the prophylactic dressing for sacrum and heel. Multi-layered foam dressing, especially Meplex for the sacrum, is the only multi-layered foam dressing to prevent pressure injury and distribute the pressure on sacrum that proved by randomized controlled trials. So, however, when you use the prophylactic foam dressing, you have to perform the pressure injury prevention bundle together. So you have to perform the other prevention practice for pressure injury. Prophylactic dressing is helpful to prevent heel pressure injury also, especially like this multi-layered foam dressing, Meplex photo here. In Korea and also in our hospital, we use the prophylactic dressing for heel pressure injury with the heel suspension and the heel elevation practice. Yes, it might be it is the rest activity. Okay. Thank you your attention. Thank you. It's done.
Okay, thanks a lot for your presentation, Ms. Wang.
Yeah.
I'm sorry, I forget to introduce myself. My name is Ungki. You can call me Ungki.
Ungki?
I'm sorry, Ms.
Yeah.
Wang.
No.
Okay, for the next is question answer section. For everyone who want to ask question, you can type on the chat box now.
Yeah. I can.
Oke, untuk sorry, I will use bahasa Indonesia. Untuk yang mau bertanya tentang materi yang telah disampaikan sama Ms. Wang, silakan langsung tanya di textbook saja. Okay. Okay, Ms. Wang. While we are waiting for the question, I have some question about your presentation. Can I?
Yeah, okay.
According to your presentation, what is the hardest wound that can be healed by NPWT?
Excuse me, can you one more? Okay.
What is the hardest wound
Ah,
that can be healed by NPWT?
you mean that, okay. You mean that what case of NPWT?
Yeah.
Yeah. Usually I apply the NPWT in chronic wounds, like pressure injury, maybe stage 4.
Yeah.
Yeah, stage 4. So, and I usually use the NPWT descends the surgical wound. Descends the surgical wound. So, yeah. So, we can use the easily NPWT system and the NPWT form, so we can anyone prescribe the NPWT system when I if I want to apply the NPWT to patients. So yeah, we usually use the pressure injury and the surgical site infection.
Okay, thank you, Ms. Wang. Ms. Wang, there is a question from Hesti Ramadhani. And NPWT drain dressing very nice, but what about pricing and for middle to poor patient? It's possible to afford it, or it is covered by medical insurance card.
Okay. Can I see their what's it? Can I see their okay, can I see the question?
Okay.
Okay. Yeah. Yes, we yeah, okay. Medical insurance in Korea, medical insurance guaranteed by national, we almost all patients covered by medical insurance in Korea. So we also, but no. But NPWT is have a limitation to use by medical insurance. So we can use the maybe 100. 100 is guaranteed by medical insurance, and then they have to more charge to use the NPWT. But and like this, maybe patient is very poor in Korea. They what is it? National healthcare system for what is it? Guarantee, and they instead of pay to hospital, so it is not that problem in Korea.
Okay,
Yeah.
thank you. So they can pay by insurance card, but there is a limitation for this, right?
Yeah, yes, right.
Oke, jadi apa ya? Kalau kita artikan itu NPWT itu bisa dipakai di Korea, tapi ada batasannya. Jadi tidak dibayar 100% oleh pihak asuransi di Korea. Mungkin kurang lebih seperti itu. Oke, is there any question? Ada pertanyaan lagi? Silakan ditanyakan di question box.
I have one question. to
Yes.
you. Oh, okay,
Yeah.
okay. So there's any government.
There is a new message.
Yeah, I see the message. There is any government.
Okay, I will read the second question. Can I?
Yeah, yeah.
Okay, the second
Yeah.
question is, there is any government incentives for the case?
For the case, what is case? You mean that the incentive to patient or to me?
There is no detailed information from this question. Only there is any government incentive for the case. Untuk Mas Rahel dari Klaten, silakan didetailkan lagi pertanyaannya. Okay, what is your question for me?
Yeah. Okay. Yeah. I warned the international conference is for all Indonesian nurse. Is this right?
Yeah.
Just WSN or all Indonesian nurses.
This live is can be watched by all of Indonesian nurses.
Okay.
Have you visited Indonesia, Miss Wang?
Yeah, Bogota.
How many times?
Just one, and maybe 5 years ago. Yeah, I
Okay.
went to the Bogota to attend the Apena.
Okay.
Apena, yeah. So
Apena.
yeah, Apena. Maybe 5 or 6 years ago.
Okay.
Yeah.
Have you eaten Indonesian food?
Yeah, it's very good. It's very beautiful, and especially Bogota is very have a nature, with a beautiful nature. So I went to the park.
Yeah.
It is very the popular park. It's a very big park.
Do you remember the city?
City, yeah, Bogota. 아니었나? Bogota. I'm sorry.
Yeah, it's okay. Miss Wang, there is one question more.
Yeah.
Hello, Miss. Are you not using chlorhexidine for wound disinfection?
Yeah. In Korea, chlorhexidine is also used that. We also use the chlorhexidine for when we dressing. No. Usually chlorhexidine used just the surgical surgery unit for scrub. When we apply the dressing, we usually use the betadine, povidone iodine. Don't use the chlorhexidine. It is not usually.
Okay.
Yeah.
Okay. Thank you, Miss. This is Dr. John.
Yeah.
So yeah, because I have experience working in Saudi Arabia for 3 years, and I am assigned in cardiothoracic unit. So usually we are using chlorhexidine for our patient, most especially if we have patient who are allergic to povidone iodine. So in Korea, if in case the patient is allergic to chlorhexidine and povidone, any alternatives for us to use for disinfection?
I see. Yeah. Like this case, like allergy reaction. Like this case, we can use the chlorhexidine. But basically, first choice is the povidone iodine. And then if a patient reject to use the povidone iodine, or patients have allergy about the povidone iodine, like this case, we can use the chlorhexidine. Almost the unit and the ICU have a chlorhexidine, but this is not routine.
Okay. Yeah, because I think most of the super bugs in the ICU. We are calling it super bugs. And, you know, sometimes it was advised by our infection control nurse to use this chlorhexidine body wash for our patients who are positive with MRSA.
Yeah.
Yeah, I think our patients are going to take shower using that body wash, and then for 7 days, it's like every time. Is it really effective for example, for MRSA, chlorhexidine?
Yeah.
Okay.
Yeah.
Mm,
Yeah. I know in Korea in Korea I know in Korea you use this method. Yeah.
yeah.
But I experienced about just the dressing. Yeah.
Okay, thank you, Miss.
Thank you. Yeah. Oh, yeah.
Okay, there is one more question, Miss.
Yeah.
Miss Huang,
Yeah.
for burn care dressing, especially bulai, how to clean the wound?
Yeah, I think we I recommend the other nurse and the other medical staff. I usually recommend that them if you decide the dressing change or cleansing the wound, you depend on the exudate. So like this case, if you have it is not important to burn or pressure injury, and the other wound, because if you have, for example, patient have a burn wound, but it is a very exuding wound. Well, I think you need the dressing change and the cleansing frequently. But if it is not exuding wound, it is not need the more change dressing. So like this pura, if a patient have pura and blister, more 1 centimeter, you need the aspiration. You need the aspiration century, and then we change the dressing depends on the exudate content and exudate to yeah. Is this enough
Okay.
to understand?
Yes.
Yeah.
Thank you, Miss Wang, for the answer. So nice to meet you first.
Yes, nice to meet you.
Yeah, first of all, I had to work in Saudi Arabia for 2 years in emergency department.
Yeah.
And yeah, and I have a patient. One day there is a child, there is a kid, it's a boy, and have like a burn care, and he had the bulla. So some senior nurse asking me to break the bulla. So is it right procedure or no? I mean, yeah, there is some pro and contrast for the bulla. We break, we took the water inside with aspiration, or only like standard dressing. Yeah. That's
Okay.
it. Thank you.
Yeah. Okay. I think like this case, the important is the maintenance the epidermis. Yes, if you want to aspiration the bra, just we have to effort to just aspiration the bra, and we keep the epidermis because the pediatric patients okay. Yes, it's on. Oh, excuse me. Oh, yeah. Ungi, Mr. Ungi.
Yes. Bagaimana Mbak Hesti tanggapannya?
Iya, udah. Jadi diaspirasi ya.
Yes, I recommend the aspiration.
Aspiration and
century.
break the
and
bulla.
you have to no broke the epidermis. Yeah. Yeah. Because
Okay.
we have it. Yeah. Keep the epidermis. Yeah.
Okay.
Okay, thank you, Miss Wang.
Thank you.
Okay, this is the last question, Miss Wang. Can I read it?
Yes, I read that.
Okay. I would like to ask you how to determine the length of the time that healing wounds heal the patient as you describe them. Then, whatever category in the wound assessment can be redefined. Thank you.
Yeah.
How to determine the length of the time that healing wounds heal the patient as you describe them. So it's like the duration of how long the wounds will be healed.
This question means how can you decide the healing time?
Yes. Healing time.
To patient. So and how can you express to patients? Is it right?
Yes.
Yeah. I think it is a very difficult question because because sometimes I depend on my experience to express the healing time to patients. So at first, pressure injury in pressure injury, I express the healing time for a very long time too, because we need a very long time to heal the pressure injury. So maybe it depends on pressure injury stage, like above stage 3. Above stage 3, we express the time to maybe 6 months or 1 year.
Wow, it's so long.
Yeah, it's very so long because So and the right and the other acute wound, if a patient have an acute wound, I usually express you need the time to heal for 2 or 3 weeks, because if you have to keep the method or keep follow, if you have to follow my method.
Yeah. What factors that influence the healing time? What factors that influence the healing time?
It depends on wound, but I effort to the time. I effort to healing to time the maybe 2 weeks. 2 weeks, 2 weeks, because if time needs more time, if patient needs more time, they complain about the wound healing. Yeah. It is same in Korea.
Okay, Ms. Wang, I think this is the last question.
Last question.
No. I mean, that is the last question.
Okay.
And I think it's enough. Thanks a lot, Ms. Huang, for your presentation. And can you give a motivation word for every nurses in Indonesia?
Well, I think I want to again meet you and meet almost many Indonesian nurses in Jakarta or Indonesia. I hope.
Okay, thank you, Ms. Wang.
Thank you.
Okay. I think the duration is still there, Ms. Wang.
What?
From the operator, the duration is still there. I mean, we still have a little time to talk.
we need time to talk?
Yeah.
Yeah.
The operator asks we to wait a second.
Okay. Okay. Okay.
Hello, Miss Wang.
Other nurse.
I still want a
contact-
question, but the moderator not read my question.
Okay.
Which question?
Okay. I read in message about the hello at first at all. My name is Tia. I'm also nurse in Indonesia.
Yeah.
So what I get the point from the NPWT management is to make sure that the wound should be kept in the moist. And how about the one that we need to dry it faster? I mean to make it dry faster. Any specific wound that can be treated by NPWT or any raised infection that can be treated from NPWT, and how if we use time wound management without NPWT, and which one is faster to cure, with or without NPWT? Thank you.
Thank you. I know. You mean that yes, your question means the NPWT is.
Yes, NPWT is the focus. The management of the wound is to make sure the wound still keep moist.
Yeah.
Right. But the question is, how if we want to make the wound to faster dry? I mean, any specific wound that we can treat with NPWT. For example, we use time management wound, but without NPWT, which one is faster also? So in one, I have a lot of questions. Sorry.
Okay. I know. No. I know. I think. Yeah. I think NPWT is helpful to improve the wound more than other dressing, or like hydrofiber or like arginate, calcium arginate. So, which one is the best to cure? Yeah, the NPWT is the best, more than other dressing, and because the NPWT controls the more sedate and NPWT effect of NPWT is important to contract to the wound contraction. So it is help to improve the wound more than other dressing. So and your question is how if we use time wound management without NPWT? Yeah. I think it depends on the wound, but I think maybe patient have an infection wound, so I recommend the wound change frequently and one time in daily, minimize the one time in daily. And if you need more dressing, wise, I recommend them twice or more than in daily. Is it enough to your?
Yeah. I get it. I get it.
Okay.
So that you recommend NPWT is better than other treatment for the wound, right?
Yeah,
but
right.
we should choose which one that this one have infection or no, because based on the wound, not for all the wound, right?
Right.
Okay, thank you, Miss Wang.
Thank you.
Okay, thank Ms. Wang. Thank you for your very detailed information about the wound and how to heal it. And for this is my last word. Thank you for your presentation. And PP and I, Alvin in Indonesia, say thank you for your information. Okay, goodbye,
thank you.
Ms. Wang.
Thank you. Bye bye. Oh, thank you. Bye bye.
Bye bye. Okay, for the next search, Mr. Joel. Good morning, Mr. Joel.
Good morning. Good morning. Can you hear me?
Yeah, I can hear you very well. How are you, Mr. Joel?
Yeah. I'm fine. I'm fine. Thank you for asking.
Okay, Mr. Joel. Your material study is management of nursing care in the healthy and sick elderly in independent nursing practice, right? Okay, Mr. Joel, I think you can start your presentation. The time is yours.
Terima kasih.
Yeah, very good. Sama-sama.
Can you see my screen?
Yes, I can see your screen.
Okay. Yeah. Thank you. Selamat pagi semuanya. Aku sedang mengkaba.
Yeah.
Yeah.
You are learning how to speak Indonesian, right?
Just a little because I've been to Indonesia since 2015, almost every year, and it just stopped when COVID-19 pandemic situation happened. But I've been to different places of Indonesia, like in Ponorogo, in Jakarta, in Bali, in Tulungagong. Yesterday, I had a discussion lecture with Tulungagong. Yeah, yesterday. But nevertheless, thank you for inviting me to be here. Our topic this morning is about nursing care among the elderly population. Although I will be talking both the independent care of the sick and the well elderly client, but generally I am talking on the independent practice of nurse as a care provider, both in the community or in the clinical settings. And how are we going to utilize the available technologies that we have in order to advance the caring for the elderly. So the order of my presentation, it's not long. We are going to at least see the population demographics of the vulnerable population and how this population statistics able to affect and affect the healthcare system, not only in the Philippines, but even in Indonesia or across the Asia Pacific region. Principles that is to be performed in the conduct of elderly care, innovations in the population care support, the public policy. There is a need for us to participate in the development of any guidelines or any protocol for that matter, and what are our involvement as care provider in the community or in the clinical settings. So this is just a statistics, a picture of how the Asia Pacific or the top 10 countries in Asia and some parts of the EU are aging in terms of the chronological age. No, this is based on the 2020 census. I mean 2019 census of the United Nations regarding the population for the elderly. But more specifically, I would like to highlight in the Philippines and in Indonesia. In Indonesia, as of 2020, there is a 6.5 increase of the elderly population with an annual rate of 1.7%. So although this is quite a good number, but there's something that we need to prepare on, especially that aging is inevitable. We cannot stop the aging process, and the global population is aging. No, every day we age, and in the Philippines there is also a statistics of 5.7% increase with a 1.4 growth rate in every year. So this is the picture of how the world or the different countries are aging. And to that note, it is important that we have to do something about it, since everyone, as I've said, chronological aging is something that is non-negotiable. We really have to pass through this process, and the policy, or every institution, or should I say every government, should at least create fundamental principles on how we can address this concern. Aging is not a problem to begin with, but this is an opportunity for the healthcare providers or the sectors concerned with healthcare on the exercise of their nursing practice, either in the community or in the clinicals, or even the development of different programs and policies attuned with the care for the elderly client. With the SDG, or the UN Sustainable Development Goal, defined number 3, goal number 3, the good health and well-being, wherein all our efforts should focus, or should at least reach on the well-being of the individual, the good health and well-being. This is across lifespan, not only for the young or for the people of reproductive age, more so with the elderly client. So when we make our proposals, when we perform our tasks, okay, be it in the academe or in the clinical settings, we have to make sure that we are targeting one of our outcome should hit towards the UN goal number 3, which is providing health and well-being, or maintaining well-being for the people across lifespan. The implications of aging to the population, to health systems, as I have said earlier, this is not a problem, but an opportunity for us to exercise our clinical practice. There are a lot of implications, and I would like to highlight 3 of the most important. One is the healthcare expenditures. As I have said, aging is non-negotiable. Our roads are not meant to be traveled on a backward motion. We always gearing towards, and we always advance from day to day. And that connotes that an expenses afforded for the elderly care is quite high. And although we have this medical insurance or the health insurance provided by the government, I know you also have there in Indonesia, similar that of the Philippines. But we have to, I think, revisit or to re-enhance the contents or the provisions of that healthcare insurance. It is more of the curative management. When one gets hospitalized and you have the insurance, so that will be covered, the expenses will be covered. But this is not a similar story when a normal, aging client is experiencing this depreciation of physiologic functions. I'm referring to the example, the home for the aged. I am not sure if there is a home care facility in Indonesia that is government owned, but in the Philippines, we seldom heard of this home for the aged, considering that our culture, the Filipino culture, is quite aggressive. When I say aggressive, we actually take care of our aging member of the family. We just don't send them to any separate shelter for the elderly client. And so when there are concerns of the elderly, not necessarily relating to disease or to any impairment and the like, the healthcare insurance, the policy suggests that it is not being covered with the said insurance, especially that given by the government. So that's one thing. The aging population or caring for the elderly is a $1 million industry. That's why in the Western countries, example in the US, there is a what we call this, a huge or a significant figure, the rise of their home for the aged facility, where they put in their aging population to an exclusive, should I say, or a dedicated space for them to live, and as they wait for their son to set down. So that's one implication of aging to the health systems. Another is the older adults are the heaviest users of health services. As I have said, day by day, we are experiencing the process of aging, and there is depreciation of the different body systems. And there are those that will, just go into the clinics whenever they feel badly ill, but the pain threshold or the pain tolerance of the elderly is quite high. So they just experience the pain or a bit of alteration. They just take it from themselves. That should not be the case. The purpose, the golden rule of caring for the elderly is not to cure, not even to restore the health, but to assist them as they live the remaining years or the remaining days of their lives. It's more on preventive, if there a word, to prevent the possibility of depreciating values, especially on the physiologic. So that's the fundamental rule when we care for the elderly, that is to assist them while waiting for their son to set down, or the moment they die, at least they die gracefully. There's a case like that. So another is to improve the manner of caring based on the culture and with respect to the ethics, the ethnic based caring, or the cultural sensitivity when we care for this population. we are nurses are actually familiar with the different theories of aging and the different theories with respect to culture. No, so we always have to respect the ethnicity and the culture of our clients. No, especially when we work overseas, we make sure that we respect their culture, even if we ourselves are culturally sensitive as well. But as I've said, we need to consider the culture and the background of the population of the elderly, since it is embedded in their system. Successful aging is what do you call this? Is seen, no, with these three interrelating conditions. Now, successful aging means a continuous engagement of life. This is one of the, like, there are myths, no, that when we age, we do not perform the task that the usual, people of reproductive age are engaging. It is not. The successful aging is not starting by age 60, but it is starting the moment we decide and to prepare how we wish to live at the age of retirement. So we need to actively engage in the different life activities. It doesn't mean that when we age, we depreciate and we eliminate some of the tasks that we usually are doing. Okay. High mental and physical functions allows that even if we age, there are still opportunities for us to maintain the physical activity or the functionality of our physical functions and the mental function as well. We are not bound to say that it is incorporated or it is associated, like Alzheimer's or dementia is associated to aging. It doesn't follow that way. Okay. And the low risk of disease and disease-related disability. So there is a research actually, but I can share to you that earlier that, as I've said, the aging process or the preparation to be successful in your retirement age starts at least at the age of 40. It is not on the 60 years old and above. We cannot prepare our retirement by the age of 60. We have to plan that ahead of time. Now, so while we are on reproductive age, while we are on the period where we can still do some, tasks and even manage our finances, this is the best time to prepare for our retirement period. Regardless of the manner of care, be it in the clinical or in the community setting or even in the home setting, the principles of independent caring is not changing. And these four major principles are the considerations when we care for this vulnerable group. Number one is we need to establish a good communication line, not only with our client, but also to the support system or to other healthcare provider or those who are involved or indirectly involved in the care for the elderly. So I think there is no need for us to elaborate on what good communication is. It is not just verbal, as I've said. It is also, nurse is bound to communicate through nonverbal cues. And it doesn't follow that when we communicate verbally, the person listening right before us is able to understand. Sometimes people speak, people able to hear what we are talking, but they do not understand. There is this a thread, separating between understanding and better communication. So when we have to care for the elderly population, good communication is a must. And the communication here refers to the ability to translate the message at the level of understanding. Another is the integration of the biopsychological and spiritual care model. When you say integration, when we care independently, we need to be knowledgeable on the different changes, not the physiologic, the psychological changes, and as well as the ethicality of the care that we are doing. Sometimes we are following a particular protocol, but it is not acceptable to the cultural lens of the client, so nothing would happen. So we're able, at least we're able to integrate, to associate, we're able to combine all the models with the dead purpose, with the dead end of able to obtain the outcome, which is assisting them as they age. Okay. Another is the continuity of care. There are clients, example, the elderly, hospitalized, and the process does not stop there the moment they are discharged. There must be a continuous delivery of care, and that's one of the industry that we are less sensitive about. No, the moment they are discharged in the hospital, seldom the mechanism of doing a follow-up is being observed. And that is one of the challenge of independent care of an independent nurse practitioner to continue with the follow-up, or to make sure that the treatments as advised by their medical doctor is able to, being performed at the home setting. The problem is the family members, although they are very much supportive, but they are less knowledgeable about the process, considering it is too technical. And the role of independent care provider is to make sure that the language of caring is being understood at their level. So again, it is a matter of communication, the family and home support, or the independent or the important others should also be educated on the principles of care. It doesn't follow that even if they don't graduate with a bachelor's degree in nursing, they still are capable, or they can be empowered in order to continue the care needed by the members of the family who is aging. I have here some important notes on how we can support the elderly care even at the home setting. Now, although I am right now, there is an ongoing discussions between private and public partnerships regarding the care for the elderly at the home setting. As I've said, it is a different climate in Asia, but in the Philippines, there is a less percentage of facility solely dedicated for the elderly care. Now, this is not actually this is a welcoming development for caring for the elderly, but there must be a continuous collaboration between the government and the private sector on how we can enhance the delivery of care for our vulnerable population. So I am talking to the collaboration and the partnership. No, it is very possible to do this. Right now, I am in a communication with a private institution regarding the possibility of establishing elderly care in the Philippines, knowing that my cup of tea is more on the elderly care and elderly abuse. So the issue of geriatric caring or gerontology is getting spotlight now in terms of healthcare. Home care, as I've said, our culture is very particular, and we have to respect that. Uh, Home care, wherein we have to educate the support system, or we have to establish protocols or mechanism where continuity of care is still afforded even outside of the clinical setup. And the use of technology, we need to optimize, to maximize the technology that we are having. Assistive technology here is not only defined as to the use of computers or any high technology, but even to the therapeutic use of self. We ourselves as a technology, the moment we introduced innovations in order to advance the manner of caring, or at least to advance or to have the quality of life of our client. So assistive technology, I repeat, is not just the use of computers, the use of Alexa, although they're important, but we have to become innovative the way we perform the things within the premise or within the acceptable principle of caring. These are the possible areas for the development of policy. As I've said, the industry of elderly care is rising, and we need to put emphasis on wellness, health promotion, and cost containment. I've mentioned earlier that the golden rule of caring for the vulnerable population is not on cure. It is not on giving medications most of the time, but we have to maximize the local resources that we have. We call it globalization. We have to establish global competitiveness in terms of our manner of caring, while maximizing the local resources, recognizing the local resources that we have. We can be globally competitive while maximizing the available local resources at our community level. So the emphasis for wellness, the promotion, and cost containment. So maybe some of you here are into, the government service, or are planning to join, public service. You have to be the voice in order to establish this line, to be very aggressive when it comes to providing benefits and care services for our elderly client. Another area for public policy is the long-term primary care and its care provider. Sometimes we are only focusing on the welfare of the adult client, for the elderly people, less on the care provider. We are not, sometimes we do not care if they were exhausted, if they were stressed, if they were mentally, exhausted as well. No, what we are thinking is, as far as they're receiving their salary, it's enough. No, we should also take care of their mental well-being or the physical well-being of our care provider. When they are exhausted, they accidentally or unintentionally commit abuse of any kind to our elderly population. So the policy should not only focus on the effects of primary care to the elderly as a client, more so with the care provider. Another is the costing and the coverage for elderly care. As I've mentioned, it's on the insurance, or the policy insurance. It's more of the curative or medications, no, for the healthcare costs. But what about those who prefer to stay at home and just taking in for their for whatever pain they are experiencing? who will take care of them at the home setting. So that should be covered as well by the insurance, the health insurance provided by the government. Another policy that can be looked into is the training solely dedicated for gerontology or for the geriatric advocate care provider. It is not telling us that those eligible are only nurses who are done with their 4 years degree and they are eligible to take care of the elderly. We can even train those family members, no? And we call them geriatric advocate care provider. In Indonesia, I think there is what we call a keder or a cadre at a community based. It's keder or kedre. So they should be trained at least with the fundamentals, with the basics of elderly care. So as I've said, the role of the nurse towards primary care is very crucial. And one of that is providing expertise in assisting and developing the healthcare reforms. Sometimes we are very much good at talking and we do not send our idea to a talking table. That means we do not present proof, we do not present facts. We just, give our words or our idea, but not backed up with any statistics that is really taken from the grassroots. So that's also the role of research, to be involved in doing scientific works of research, because the decision makers, the policy makers are looking into statistics, figures, and that's one of their areas to consider to give their, decisions or to whatever plans that they have for the future. So we need to give our expertise in assisting and developing healthcare reforms. We also have to be active in the engagement, like joining organizations about elderly care and their health-related concerns, provide testimony at the legislative and public hearings on healthcare. We also can serve as members of the committee charged with the studying of healthcare. That's why in this organization in Tulong Agong, I congratulate you for this activity, and this is the start of discussing areas or discussing health-related issues, not only with the elderly, but with other interests on healthcare. And as I have said, the advocacy agenda within and outside areas of the policy. This is our moral imperative, meaning nurses are not bound only to be, the healthcare provider or to be nurses on the bedside, but we have to go out and try to meet the thread between legal and moral, and try to see in which area where we could do better. And the ultimate aim, as I've mentioned, is on at least the quality of life, the heightened quality of life of our population. These are just some of the standards of the practice of geriatric care. No, I've extracted this from the 1987's policy on the standards of gerontological nursing practice. So as I've said, this is not only focusing to the clinical area, more so with the community or in the home care setting. So all practice, nursing practice with relevance to elderly should be planned and be directed by a nurse executive. And that's one thing that is non-negotiable. We really have to follow the protocol stating that everything prior to its implementation should be planned. And I think this is not new to the nursing profession. We are following our nursing process. The nurse should participate in the generation and theory testing as basis for clinical decisions. This is the very logic why nursing is an evidence-based profession or evidence-based practice. We cannot just implement or we cannot just introduce some innovations without prior testing to a theory or without due performance or exercise of this practice. No? The health status of the elderly is assessed on a regular mechanism, comprehensive it is, accurate it is, and in manner systematic. Okay, this is still under the protocol of the nursing process. Nurses use the health assessment data to determine the nursing diagnosis. This is not new to us. The data should be observed or should be acquired objectively, and the nurse should critically analyze. No? Even if we have richness of data, but we cannot afford to do or to decide what implications of this data be. So the information will become useless. No? Similar in the hospital setting, we have a good number of data. Example, the admission rate, the example in the time of COVID-19, the demographic attributes of those being hospitalized are good data. But the question is, what are you like? What did you do with the data? What are some of the realizations, or what are some of the decisions obtained following the presentation of data? So the nurse, as a researcher, should be able to align or should be able to develop new policies or guidelines because of this existing information. No, so I hope that everyone here is actively engaged in research. Nurse also develops the plan of care in conjunction with the older persons and appropriate others. It is true that the nursing process is not a nurse-centered plan, but it should be the client-centered plan of care. Meaning, as I've said, aside from incorporating the culture and the mores of that elderly, you also have to ask the important others if they were able to grasp the plan that you are crafting. May it be a short or a long-term plan for the client. So the nurse primarily develops the plan in consultation with those interested parties or interested stakeholders. The nurse assumes responsibility and contributes for the professional growth of the interdisciplinary team members. We are not working alone by ourselves. We have to do due credit to the other members of the paramedical team. We have the doctors, we have the dietitian, we have even the auxiliary and all. So these team members have equal footing, because they're also having goals to meet in order to care for the elderly client. But primarily, we have to assume the responsibility and for the professional growth, not only with ourselves, but also with other members of the field. This is one of the example. Right now, the Tulong Agong Regency is doing the international conference, and this is your contribution for the continuous professional development or education of nurses, of our colleagues in the profession. nurses continually evaluates the family responses to interventions. And again, the word is to collaborate among the health team in various settings in which the care is being provided. The nurse also participates in research designed, to generate a body of knowledge, or to at least contribute to the ever-growing gerontological nursing knowledge and disseminating informations and to use them in their practice. So from the generation of knowledge through the process of research, we have to disseminate the information, because the process of research is not ending the moment we develop the findings or we generate recommendations. The process will culminate the moment you disseminate these findings, you communicate these findings. In what means? Through attendance to fora, or even to activities like this, or presenting in, example, a conference or a symposium, or even writing your data findings through publications to journals. These are some of the areas where nurses have to be actively involved in order to impact the quality of life for our population. And last but not the least is the code of ethics for ethical decision making. Now, so it is very important. Aside from the culture, we also have to be guided with at least the suggested code ethics for nurses. I think that's the end of my presentation. I intentionally make this brief so that there would be much time for discussions to have clarifications if there are any. Terima kasih.
Okay, thank you for your very detailed information, Mr. Chu. I am forgetting one thing, that I am forgetting about reading the curriculum vitae.
No problem, no problem.
Okay, sorry for the errors. Okay, Mr. Joel is graduated from the Doctor in Nursing Science, DNS, Saint Paul University, Philippines, to Garau City at 2019, and graduate school program nursing and the Master of Arts in Nursing Major in Medical Surgical, Southwestern University, Cebu City, 9000 at 2011, and undergraduate program school and that obtained at Bachelor of Science in Nursing, San Lorenzo Ruiz College, Ormoc City, Leyte at 2009, and secondary program at the Dr. Geronimo Basil Department SGA of Fisheries, Albuera, Leyte at 2005. And now Mr. Joel is working at the Dean College of Nursing Visayas State University, Viscar, City of Baybay, Leyte, Philippines, and regular paper reviewer nursing at the Midwifery Journal of Health and Management, Stikes Patria Husada Blitar, Indonesia, and also the chief editor Alliance of Health Activist Journal Advancement, ISSN, Jalan Ngurah Rai, 18 Bangli, Bali, Indonesia, a peer-reviewed journal for nursing education and management. Thank you for your very detailed information about how aging and nursing. And for everyone who want to ask the question, you can write in the chat box. Oke, untuk audiens, silakan yang mau bertanya, silakan chat di text box. Okay, Mr. Joe, there is one question. Can I read it? How about telemedicine? What standard best of use for these sectors? From Rahel Klaten.
Yeah, I think it's the one who raised the question refers to the telemedicine. Okay, the telemedicine started or highlighted, is being highlighted during the pandemic, when there is no opportunity to travel and when there is no opportunity to go to the hospital for a possible consultation because of COVID-19. Now, telemedicine is maybe one of the technological mechanisms that we can adopt in order to continue the caring process via online. No problem to that, but sometimes there are diagnostic examinations that you have to perform physically, or needing your physical presence in order to at least to be diagnosed better. Okay, so but again, the idea of telemedicine is a welcoming idea, and I think most countries are experiencing or now adapting to this new breakthroughs in healthcare. I know of somebody or someone in the Philippines that is subscribing to telemedicine type of service to have the follow-up checkup or to inquire at least to the status of their health. No, but nevertheless, technology, the use of telemedicine is one of the welcome technological development for healthcare.
Okay, thank you for your answer. Oke, terima kasih Mbak Rahel atas pertanyaannya. Jadi menurut Bapak Joel, langsung the next question. A very long question. I will read it from Mbak Hesti Ramadhani. Okay, morning Sir Joel. Morning Sir. Kamustaka. What? Sir, at the time I work as family nurse, and for sure the patient age was 70 plus and very irritating, sensitive, more often angry. Oh my God. And the problem is there is no instrument for nursing report to measure the aggressive behavior that can be used daily. Is there any suggested measurement for my case? Or perhaps there is some instrument to measurement for the aggressiveness of the elderly patient?
Yeah, thank you. Thank you for that question. Regarding the measurement, I think the person is referring to the tool, the instrument, a validated tool in order to assess the aggressive behavior of the 70-year-old client. For now, I don't see one to measure the aggressive behavior of an elderly client. But as a nurse, we have to widen our understanding. We need to, to increase our patience when caring for those type of clients with unpredictable mood behavior. So I think what you can do is try to document. That's why we have to go back. If you remember with the standards of care, we're always guided with the nursing process. There is no technology yet that will detect the changes of behavior, but you yourself, no, should be a good instrument on the on the on the way of how you can innovate. Okay, and the therapeutic use of self, as I have said earlier, should be your weapon, okay, in order to address the ever changing unpredictable behavior or being aggressive condition of your elderly client. As I'll go back with the measurement tool. I think we don't have one. I think at least you presented that, no, in this conference, so we can think on what we can do. At least developing a tool for that. What I have developed, as I've said, my cup of tea is on the elderly care and elderly abuse. I developed the Filipino culture driven tool for knowing or assessing if the elderly is abused or not. I have that tool for the elderly assessment tool for the elderly abuse. But as to the behavior tool that you are informing us right now, I think that is a good opportunity to study and explore. I think you can work with me in the observations or what you have observed, and we will make research to that. That is our contribution to the science of elderly care. Yeah, you can communicate with me through my email so that we can develop a research proposal for that. You know what? That's what I am telling about innovations. Sometimes we observe a lot in the workplace, but we do not know what to do and how to deal with those data, with those information. So we need to translate that into something beneficial that would increase or at least improve the quality of life, both the care provider and the recipient of care. So with that question, I have to be straightforward. As of now, I have not seen any tool about assessing or measuring the aggressiveness of an elderly client. But on the other side of the coin, you yourself has to be observant. What makes the changes of behavior so drastic? No, maybe there are some factors in the community setting or in your setup that led to the what do you call this? That led to the change or the unpredicted behavior of your client.
Okay, thank you, Sergio.
Yes, Dr. Abarao, if I may add, shared a file on the benchmarking tool, no? But you have to see the tool and to study. I, for one, will have to download this because the care for elderly, as I have said, is although this is not highly individualized, no, but we make sure that the tool is culturally sensitive. Now, the culture takes a very pivotal role in the care of elderly. Thank you, Dr. John, for sharing this tool. I hope that I can download this today.
Okay, very nice answer, Mr. George. Jadi kalau kita menyimpulkan tidak ada tolak ukur khusus untuk mengukur behavior atau perilaku, entah itu tindakan yang membuat si pasien itu mudah marah atau si pasien itu mudah teriritasi. Jadi menurut Dr. Joe itu tidak ada alat atau tolak ukur untuk mengukurnya. Kita perlu melebarkan ke pengertian kita terhadap kasus tersebut. Jadi mungkin seperti itulah jawaban dari Dr. Joe. Okay, for the next question, you can send your question on the chat box. Can I give one question, Doc?
Sure. Go ahead.
Okay, I ever heard one sentence like this. There is a biological age and chronological age. What is the difference between this age? Okay.
Yeah. Yes, it's true. I made mention about chronological age in one of my presentation. When you say chronological age, that refers to the years the person has lived for all throughout his life. Example, when you have your birthday, no, my birthday, for example, is on May 15. And so every year I am celebrating my birthday. So right now I am 30 something. so that means that's my chronological age. So the chronology means that is increasing, increasing of age from year to year. So every day we are aging, and that's what we call chronological aging. When you say biological aging, it has something to do about the biological structure of a person. Sometimes we are, like example, I am 33 years old, but I look like older than my age, or
No,
others may define me or may describe me as, but I know that I'm looking younger, but that is just for the sake of discussion to compare about chronology and the biological aging process. There are people who are younger or older than their actual age, and that is biological aging. There are a lot of technology driven interventions. Example, your what do you call this, your liposuction, for example, or rhinoplasty, for example, or different operations or whatsoever. That Botox, yes, thank you, Dr. John. Botox, for example, that may not affect the chronological aging as per definition, but will delay the aging process. This will not change the process of aging chronologically, but this technology-assisted procedure may delay the process of aging. So that's biological age. Sometimes, as I have said, you look older or you look younger than your age, and that is biological aging. That's why I made mention earlier that the very crucial part when we plan for successful or healthy aging will not start at the age of 60 years old. That is already the retirement age. So we need to decide, we need to design as early as now on what would we want when we reach that retirement age. And that would become, example, the institution of our financial capacity, or may investment to healthcare, insurance, and the like, because these are very important factors that may help us, that are very important as well when we reach the retirement period. So, well, going back to the biological aging, as what we're discussing, people are very much concerned about the physical appearance, the outward appearance of the person, and that's the biological definition of aging. No, and but let's not forget that whatever technologies that we are introducing in order to look young or to look fresh, it will not stop the process of aging. It will only delay the process. But again, as I've said, the chronological aging is something
Okay, thank you.
non-negotiable.
Okay, Doc. That you said that it's just like the improvement of technology to delay the aging. How about something just like we call it a natural care to delay, just like exercising, good diet, and drinking a lot of water? Can we delay the aging by this kind of activity?
That's the most ideal, if not the best manner of preparing for a healthy aging. If we could still remember, we have the theory of the wear and tear theory, that as we increase in age, there are depreciations of our body functions. And when we are abusive, the time when we are still at the productive age right now, say for example in 30s or 40 years, no, and if we are not particular with our diet, if we are not be very careful or at least choosy on the proper example food that we are taking in, those are accumulated, or well, yes, accumulated, and we cannot experience directly the effect of these abusive acts, or this if I may use the word abusive acts. So we will experience that when we reach the age. So your idea of still be very careful on the diet, on the exercise, on even the perception, your mindset plays a very important role when we age. No, sometimes the stress that we're experiencing, we are eating stress every now and then because of COVID-19, or I don't know if we're affected with the war between Ukraine and Russia. There is economic downside to that in our economy, and that would indirectly affect the way we think and process things, that may also affecting the aging process. Sometimes we do not eat food because of the cost afforded to it following the continuous war between these countries. And well, although that is far beyond the discussion, but it boils down that aging is not only with the food and the water, or the medicines or the supplements that we're taking in. Sometimes the other context of the way we think and the way we process things, the mindset that we are having, also is taking a big part of that pie to age successfully.
Okay, very nice explanation, Doc. Thank you. So it's just like we also have to take care of our mind from negative information or something just like that to have a good aging. Okay.
By the way, one of the observations I have with my 5 or 6 years of going back and forth to Indonesia, one of the best practices, if I may say, is the way you prepare your food. No, you are very much you are very much you're paying attention to the food that you're eating. I have one. I don't know if you know Dr. Dr. Hero and Dr. Hero of Ponorogo. They are very much particular with the food that they're eating, the coffee that you are preparing. I I have not tasted all this type of food not until I went to Indonesia, like your goreng. I think that's just goreng, your bebek goreng, something like that, and your coffee. Well, we have coffee in the Philippines, but yours is different. And you know what? When I came back to the Philippines, because I love that your bebek goreng in a box.
Yeah.
However, I was stopped at the immigration because I cannot bring that different I think 6 boxes of goreng. So I don't have the option. I cannot throw it away. So I need to eat that all by myself in the in the in the airport. But what I'm trying to say is the preparation sometimes of the food, of your choice of food. You always have that spicy food. You always have that vegetable, whatever, in your diet is also contributory to aging.
Yeah, Doc. There is a lot of very delicious food, but even delicious, I can say it's healthy, I think, because it's like bebek goreng, gorengan. It's like it's delicious, but I think it's not healthy because of the fat, because of the oil, because of so many things to have to be concerned. Doc, do you know about lodo? Lodo it is like food that come from Tulungagung.
Maybe I am not sure if I know the food well. All I know is that tastes, palatable and delicious on my end. I'm not so very picky with regards to food. Sometimes I only eat there by hand, and we just sit on the floor with with the set like the table set up, but we don't have chairs. We just sit on flat on the on the floor. That's how I live when I am in Indonesia. But I always have to wear my batik, every time I go there, because that seems to be a very important attire that I have to use whenever I am talking in front of people in Indonesia.
Yeah. Batik is just like a formal use to Indonesian people, and we are as Indonesian we have to be so proud of having a batik as our national cloth. Okay, there is a comment from Miss Garu Fatra. Have you tasted sego pecel? No, you haven't.
I am not sure about. As I've said, I am so sorry because I have not known like the name of the food. But what is important is when my friend offered that to me, I always ask if this is okay to eat. Yes. And if this is not okay to eat, then I should also, prevent myself from tasting this food. But at least I know in your culture that you always have that vegetable in your diet. And one thing I like about your food is you are always having a water in your table, no, or in your office you have this water, no, bottled water and the like, less of a soft drinks or carbonated beverages. Your soft drinks or carbonated drinks are somewhat expensive. That's why maybe you are always having water in your table. But I like the company of my of my Indonesian counterparts every time I go to your place.
Okay, Doc. Thank you. I think you have to visit Indonesia more and you taste a lot of Indonesian food. And for the last, what is your maybe your message for every Indonesian nurse to close this presentation?
My message. Okay, as I've said earlier, the elderly care or the aging process is not a disease, and it is not, population aging is not a threat, but an opportunity for us to at least practice our profession, and at the same time to pay back, if I may say the word, to pay back or to give value to the people who once cared and who once dedicated their life for us. Yeah. So at least we are giving, some sort of valuing them on the most significant, or should I say the most days of their lives. No, I use the word while waiting for their sun to set down. So at least we give value, we pay dedication to these people. It could be not the patients we have in the hospital, but even to our parents or grandparents whom we are living right now and at the moment. We have to give value to whatever they are doing for us, of course, because they were once at our age, and what they're doing that period is taking care of us, making sure that we are okay, making sure that we're able to eat, making sure that we're able to obtain a good education. And that's the reason why we became nurses at the moment. And if that's the case, it is, I think, due time, a high time for us to give back or to pay back, whatever hardships that they have provided or shed on during their productive years. And so that is an opportunity. It's not a threat, no, for us. For the educators, I think there's a lot of educators here like me. You have to teach very well. We need to teach the values of being inclusive and be particular, no, to put value as well to our elderly clients. We have to nurture our students the way we want them to be, because who knows, along the way, by according to chronological age, we will age first. We'll age older than them. So at least they become effective when we ourselves will become their patients in the future. So we have to teach and nurture them the way we want them. No, so I think that would be on my end. Thank you, Makasi.
Sama-sama. Thanks, Doc, for your very nice information about aging. And we are from PPNE say a lot of thank you for you. And see you next time.
Thank you. Thank you.
By this certificate, we say a lot of thank you for Dr. Joel Ray U. Ikup TNS for your nice presentation. Okay, thanks for your presentation. You can follow the next presentation, or if you have other business, you can leave it. Thank you.
Thank you. Thank you.
Okay, for the last presentation, it's come from Dr. Jennifer Arellano Abrao, TXCM, DIPXLM, MAN, CXA, CPE, RN, USRN. Okay, I will read the curriculum vitae. Okay, good morning, Dr. John.
Good morning, sir, and good morning to all my brothers and sisters in Indonesia. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, I will read the curriculum vitae of the Dr. John. Dr. John has Dr. John has Islamic name. His name is Yahya, and Dr. John was born at February 5 at 1988 in Mandaue City, Cebu. And Dr. John's nationality is Filipino. And Dr. John is spoken with Cebuano, Tagalog, and English. And Dr. John is working at the up to present Southwestern University, FINMA, Urchil, Science Cebu City, Philippines, as the part-time assistant professor. And at the Tampa Medical College, formerly known as the Medical Prep Institute of Tampa Bay. And he is working as the full-time online nursing instructor. And Dr. John is graduate from the University of the Visayas as a Doctor of Healthcare Management at 2011. At 2014, at the University of the Visayas, Cebu, as a Master of the Art in Nursing, Major in Medical Surgical Nursing. And at 2010, in the University of the Visayas, at the Bachelor of Science in Nursing. And at 2009, Anton Kiratuli Juano Memorial National High School, Opau, Mandaue City, Cebu. And at 2002, at the Opau Elementary School, Opau, Mandaue City, Cebu. And today, Dr. John will bring the materials about all the presentation about the prevention and control of infection in nursing home care services. Okay, Dr. John, are you ready for the presentation?
Okay, thank you so much, sir.
Okay, you can start the presentations. The time is yours.
Okay, is my screen now ready, sir?
Yes, you can start it.
Okay. You can see my screen, sir.
Masuk ke Google, Bu.
Yes, I can see
Okay.
your PowerPoint.
Okay. Thank you, sir.
Yes, Mr. John.
Okay, so good morning. Good morning again. My topic for this morning would be about prevention and control of infection, nursing home care services. So I know my topic is very timely because of the pandemic that we have experiencing now, 2 years plus already. We are battling with this pandemic. But Alhamdulillah, no, thanks to Allah, that everything is under control with the management of all science-related professions who are also concerned for the protection of all humanity in the world. And let us not forget also to pray for our brothers and sisters in Russia and Ukraine and in some Middle East countries like Syria and what's this? Like Syria and Yemen and the Palestinian, what's this? Community, our brothers and sisters. So thank you, sir, for that introduction. So those are my work today. So more, I am focusing now on nursing education. I am serving in Our Lady of the Rule Maternity and General Hospital as a nursing consultant now. So I am really focusing myself in honing my teaching skills. In fact, I am also studying Masters of Arts in Education because I want to upgrade my skills in teaching, not only in nursing, not only in healthcare management, but also in education. Because like what our prophet said, Prophet Muhammad, peace be upon him, that learning is a continuous process and we will never stop in learning. So as nurses, we should continue divulge in education so that we can help and serve the humanity, most especially in today's happening in the world. No? So that's why I was shocked here in the Philippines that the enrollees of nursing student went high again, just like what I've experienced last way back 2007 to 2011. Now nurses now, students now who graduated senior high here in the Philippines are enrolling now in BSN degree for them to be prepared to take the nurse's licensure exam in the Philippines to become a registered nurse. Now, I think maybe we have the same situation now, like in Indonesia. Do your nursing education also increase in enrollees in your nursing students? Any educator here? Because that is the reality of the world. We really need more nurses that will serve the humanity. I know human as we are always faced with fear and anxiety towards every one of ourselves, to our family, and to all. But as nurses, I think we should stand up with pride and dedication to serve the humanity. And that is the real essence of being a nurse, not only by education, but in the practice of nursing. So my topic is very timely and it's very common to us nurses. It is already innate in our hearts that nurses should provide safety, which is the number one rule of being a nurse. We should provide safety for our patients, safety for the significant others, and safety to all public health. Now we are providing public health security to all of the people that we are engaged into. So if you hear the word infection control, so what comes in your mind when you hear that? Are you afraid when the pandemic surge in our country? All the lockdowns are being mandated because of that SARS-CoV-2 infection. I have also experienced this MERS-CoV infection in Saudi Arabia, where they are the same, no? They are the same as viruses. But Alhamdulillah, it's not really that affecting, no, impact. It's not that heavy impact on the Middle East, that MERS-CoV disease. It's just like a flu. And even a simple tummy flu in our management will be enough for the patient and undergoes isolation for 1 week with hydration and tummy flu only. And we will monitor always. I know there is a nurse earlier that also states that she came from Saudi Arabia. She worked also from Saudi Arabia. And I know she is very experienced because now under the Minister of Health, we should memorize the hallmark signs and symptoms of MERS-CoV in order to protect us healthcare professional and to protect the patient if we have a suspected case of MERS-CoV. So I think the Middle East is ready, no, in adapting such growing infectious diseases. Now they are also promoting their scientific experiments in order to handle such pandemic. Allahu alam, we don't know if when this will be end, but we are still grateful, alhamdulillah, that all of these cases now are coming into the curve line. So let's thank Allah for that. That I know many nurses, many healthcare professionals, frontliners lose their life with their family. So I know that with this pandemic, it teaches us to be strong. It teaches us to be innovative and resilient when in times that a pandemic will appear, like a mushroom, early in the dawn, that will grow, that we don't know where it will start. So we see different words that comes out into our mind when we are dealing with infection control. Now, as nurses, as healthcare professionals, we are always protecting the safety of ourselves and also the public. That is our main responsibility as nurses. Now, we should not forget that we took up nursing not only for a living, not only for our family, not only for the profession, but for the service of humanity. So that is where I idolize the works of Florence Nightingale, which is our founder of the modern nursing. Now we're talking about outbreak. Now we're talking about the healthcare, the frontliners during the pandemic, how we protect ourselves, how we care, how we do the cleaning, the how we look up into our health, how we look at into epidemiology, the statistics, how do we investigate, what are the equipments that we use, sterilizations, precautions, and preventions, and hygiene. And the most important is how to create that vaccine, and which is happening now. So what is infection control? I know all of us knows the meaning of infection control, but let us refresh our mind. Infection control is the practical discipline of preventing infections you get in healthcare settings. Now, and not only in healthcare settings, but also in the community. We can contract that infections in the community. So we are responsible as citizens. Now, most especially, we are healthcare professionals to be obliged, and it is our responsibility to promote health education when it comes to infection control. So related to a public health practice, infection control is an essential, very important process of every healthcare organization and even in the community. I am always emphasizing the community because I am also a public health teacher. So it addresses the factors related to the spread of infections among patients, among staff, and between patients and staff. Now, this includes preventive measures such as number one, it will not be out of the NCLEX exam. It will not be out in our state board exam in our country. Our hand hygiene, our hand washing. Now, that is the topmost prevention in order not to contract any infections or pathogens that surrounds our environment. So cleaning, disinfecting, sterilization, and vaccinating. Other aspects may include monitoring and managing outbreaks of infection and investigating their causes. So that is infection control. We nurses, most especially nurses, are the forefront of this infection control practice. Now, even Florence Nightingale, during the Crimean War, she developed the environmental theory. So she discovered the importance of hygiene, the importance of environment ventilation in order to prevent infection. So what does an infection control nurse do? It doesn't mean that you are really designated to be the infection control nurse, but being nurses itself, being registered nurses and allied healthcare auxiliaries, it is our responsibility to know the rights, the obligations, and the responsibilities of being an infection control nurse. In this job, we need to learn how to analyze infection data. We need treating people with infectious disease. So we need the knowledge, the theory on how to treat, on how to manage, on how to render nursing care to an infected patient. Developing outbreak action plan, that is a role, one role also of a nurse must develop. You need to know epidemiology. You need to know how to interpret statistics when it comes to numbers of mortality, of morbidity, and educating health professionals. Because when healthcare professionals understand the theory of a disease, the theory of a pandemic, so we are already equipped with the knowledge in order to deliver health education to the public that is valid, that is legit. Now, as healthcare professionals, we are obliged to deliver the right message to the people so that they will not be wrong in their decision making. So COVID-19 infection, we all know what is COVID infection, but the average number of new infections reported each day in Indonesia falls by more than 20,300 over the last 3 weeks. According to Google today, I searched for that. So March 11, 2022, your cases would be 16,110 with the average of 1 week, 7 day. So in our country, with date of March 11 also, year 2022, we have 583 cases with the average of 7 day. So that's why Manila and some whole part, majority part of the Philippines are under now level 1. So we are starting now our face-to-face classes. And some of the prohibitions of the, the lockdowns are already closed, but still our government is implementing the standard health protocols when it comes to prevention of COVID-19. So COVID-19 infections are decreasing in Indonesia, alhamdulillah, with 28,070 with new infections reported on average each day. That's 50% of the peak, the highest daily average. Now, based on my research, that was last week when I make my slide. So reporting on February 19, there have been 5,826 5,826,589,000 infections and 151,135 coronavirus-related deaths reported in the country since the pandemic began. So with that, I know many of our families, loved ones, relatives, and our colleagues in the healthcare professions have given their life towards serving the humanity, So I know some of us are calling us heroes, but I hope also the government in the Philippines and the government of Indonesia sees the effort of the nurses. Now, what we have done, what are the spotlight that we have to be credited of during this pandemic? I know it has nothing to do with boasting our profession, but I hope our country, as part of the Southeast Asian nations, that we should develop, we should give full respect for the nursing profession. I am one of the nursing leaders here in the Philippine Nurses Association in Cebu chapter. So I am also implementing and promoting the importance of nurses, that we should be respected, we should be treated with dignity, we should be provided with tenuity in our job, security, so that the brain drain, the brainwashing of the Filipino nurses, and I don't know the situation also in Indonesia, if we are the same, that every young BSN graduate, after they pass the state board exam or nurse licensure examination, they may render volunteer work for 6 months, or they may apply in hospitals for 6 months to 1 year maximum, because I know the run through of it, because I'm also, the nursing consultant and the chief nurse. They are easily now amazed with with the offer, what the United States has offered to our nurses, what UK offered to the nurses, and some other uh, big countries. The opportunity that they have, that they can bring their family, and with all the security, tenuity, and the finances that a nurse can have. Okay, that's why we are not so-called this understaffing, but we have we have more than nurses here in the Philippines, too many, but most of the nurses chose another field of work, even not related to nursing, because they are also afraid, they are fearful to contract that coronavirus. I myself contracted the COVID-19 virus twice. Now, while I'm rendering my service as a chief nurse, it was very stressful, but yet we survived by the help of Allah. Now, with all dedication, that I work in the morning, I also work in night in order to support and help my staff nurses in the bedside, that I, as a leader, as a nursing leader, is always there for them, that being the chief nurse, I am not only be seen visible inside my office doing my paperworks, but I am showing to my nurses what a leader should be, and I should show my support to them, because emotional support plays an important factor in supporting your staff nurses. So that is how we show empathy, we show support to our staff nurses, being the nursing leader of every institutions that we have. So COVID-19 testing for nurses. For this, it is very important that we as a healthcare professional, not only nurses, should be play an important role, that we should be tested, free testing, free testing in every institution, that we should be protected by the free testing, not only with the vaccination. Now, evaluates test characteristics, and facilities should be aware of how the tests perform, okay, for circulating variants. I know we should not be happy with that decreasing cases, but we should maintain what the government has done in protecting the public. Now, we should maintain that minimum social health protocols at all times in order to maintain the curve that we are facing right now. And anyone with even mild symptoms of COVID-19, regardless of vaccination status, should receive a viral test as soon as possible. Now, even a simple flu, with my staff nurses, even they have a simple flu, I advise them to take a rest for 5 days as maximum with the new guidelines, now to self-isolate themselves now in their room or their specific homes, now to be isolated for 5 days and then observe. And the hospital will continue to monitor the status of our nurses in order to show support also, because I know I was hired way back 2019 because when I finished my contract in Saudi Arabia, I go back here in the Philippines, and because of my dream to continue my doctorate degree and to finish it, so I was given an opportunity to be hired as a chief nurse in the institution. So I started with 25 nurses, 25 registered nurses. And when the pandemic arise during December, I think it was announced December 26, last 2019. All my nurses and all of the people working in the hospital are full of fear. And I know we felt the same. All of my nurses are rendering their immediate resignation. And I myself feel that fear, but I trust God with all my heart that I need to stand, not stand first before them. I need to show that I am strong enough to handle this crisis that we are facing. Because when I grow old, or when I will be teaching in the future, I am proud to say that I was part of giving my service during the pandemic to share to the future generation of nurses that nursing should be a caring profession, not for luxury, not for fame, not for degrees, but to maintain that definition that nursing is to care for people sick or well. Okay? So vaccination plays a very important role. I know since the day we are born, we are giving those hepatitis B vaccine. We are giving those childhood immunization, which bring a lots of protection, which the World Health Organization is promoting. Now, here in the Philippines, we are promoting a evidence wide campaign for vaccination, not only promoting the COVID-19 vaccination, but also pushing the childhood vaccination campaign in our Department of Health, because people fears about the side effects, okay, about the side effects that might be experiencing, because there are hearsays that some of them died because of the vaccine. But nevertheless, we know that from ourselves, when we are ready to vaccinate ourselves, I am always telling this to my family, to my friends, that if you want to be vaccinated, please ask first yourself if you are ready, because the power of mind will depend on your body. Once your body is ready to receive the COVID-19 vaccine or any vaccine, your body will work, your body will follow on what is the purpose of that vaccination. Okay, so without vaccines before, way back, we are not born yet. No, during the first discovery of penicillin, the discovery of polio vaccine. So what will happen if vaccination was not created by science? So all humanity will be finished. Now we all know that how strong the Delta variant is, and the Omicron. But with the presence of vaccine, Alhamdulillah, my hospital now has a minimal case, like one or twice of the patients in our hospital being admitted has been diagnosed with COVID confirmed, RT-PCR tests. Now, how was that? How was vaccination? Was gives a great impact to our public health. Implementation is very important. I know there are many people who does not believe, who receive a wrong explanation, a wrong interpretation of what is vaccination is all about. So as healthcare professionals, as nurses in the community, so it is our main role to be a role model, to be an example that you yourself should be vaccinated before the community will follow. We make sure that we, healthcare professionals, all of us will be vaccinated before the community will be believing us. Now, we know the management. We know what are comorbidities that are not allowed or it needs to wait for some rehabilitation and maintenance. So we need to promote health education in order to stop this pandemic and live again, not not as well as normal before, but at least we can move freely, just like a free people. No? So Indonesia has administered, based on my research, at least, I don't know what's the latest now, but for this numbers of statistics with a range of 354,566,415 doses of COVID vaccine so far, assuming every person needs 2 doses. So that's enough to have vaccinated about 65.5% of the country's population. So I know I have also worked with my brothers and sister Indonesian in Saudi Arabia, and we tend like to be similar. Now we have similar in our attitude, in our expression. Now because we are just a nearby country. Now within Philippines and Indonesia is not far. And when I start working here way back 2019, coming from Saudi Arabia, it's really my dream to visit Indonesia because I want to visit different kinds of mosques, no? Different sites of mosques, the beautiful uh, big mosques, historical mosques in Indonesia. Because in my place, Muslim community is very limited. It's very limited. I have some brothers and sisters also that I usually visit now when I will have a time or opportunity to visit them. Now I have my brothers. I also help the masjid. I support, I give support, most especially in Cebu. Have you heard the typhoon Ray, or we call it in the Philippines, we name it Odette? No, it really destroy some of the mosques, some of the masjid here in my place. So our brothers and sisters are helping each other to rebuild again now the house of prayer, no, our house of prayer. So Alhamdulillah, we are starting over again, and we all know that anywhere else, even without a mosque, we can pray wherever we are. So that is very heartwarming for us. Know that Christians or other sectors of the religion should be united, should help each other, because at the end of the day, we are all human beings. We are all creation by God. We don't know even the original teaching, but as we believe, we respect the culture, the religion of every individual, we will promote unity. Now, that is the most important. So in this slide, vaccinate healthcare providers. So in your hospital, do you record, or in your community, do you record the number of people who are already vaccinated? Do you monitor them? Now, when they have some adverse reactions that they experience, would the government support them with all the medical facility that should be provided for them? Now, because it will stop the fear that people will be encouraged to vaccinate themselves. But here in my country, in my place, I think people now are well educated, because when they know, when they really, see the proof that vaccine really works, I really cannot imagine how people die themselves to have that vaccine. Some of them are, lines are very long for them to be vaccinated, because they proved themselves that the vaccine really works. It is just sad to say that we healthcare professionals, we are the front line. They are telling us experimental rats during the creation, during the distribution of that vaccine, because people are afraid that we will all die and become zombies. Have you heard the story of that? That people are afraid, no, receiving that vaccine because they will become zombies after 1 year or 2 years. No, some hersays of the community. So how was that? As a healthcare professional, as a public health nurse, how would you educate? How you would be challenged? No, being a professor in public health, I am asking my student, how would you encourage the community to vaccinate themselves without, having that fear? It is really a challenge to every healthcare professional who are working in the public sector, serving the public health, on how they can encourage their community. And I know also that Indonesia has many islands, just like the Philippines. It's an archaeological, not geography, that many also, you have small islands, you have different languages, you have different culture, you have different tribes. So how would you encourage every community, most especially the indigenous part of Indonesia? Now, it is very challenging. So vaccinate residents and healthcare professional against SARS-CoV-2. So that is really the thing that I am emphasizing, because that is the start where we healthcare professionals, where we nurses can start our work without fear, or minimizing the fear that we feel. No? Before, my nurses will really get inside patients' room who are COVID-19 confirmed positive, with all the level 4 PPEs covering themselves. But now they are fully vaccinated, plus they also receive their booster shots. I saw my nurses now just wearing N95 masks, now with the simple gown, the common hospital gown that we are wearing during entering a patient now under isolation. So it gives us the boost to continue to be productive in rendering our care towards our patient and towards also our colleagues and our family. Okay, have you seen the difference now? No? So I hope that Indonesia will continue to have that curve and live a life that is less of fear and doubts towards science, towards medicine. No? So infection control recommendations for healthcare personnel during the COVID-19 pandemic. No? So how you manage, no, being in Indonesia, how you manage those patients who are advised to do self-isolation in their homes because there are no places, there are no hospital beds now available. Now, how would you encourage health education that you are sure that they are really staying their homes, or they are being taken um, with ambulance in every city, in every town? They will be placed in the isolation facility where they will be observed. Have you imagined that? No, I saw in CNN that also Indonesia suffered when the Delta variant came a lot. After India, there was really a sudden rise up of cases in Indonesia also. And I cannot imagine, the hospitals were very crowded, the isolation facilities, and the people who died at home. So how would you take care of them inside the home? They have comorbidities. And then they are also infected with the COVID-19 infection. So as a nurse, how would you save the life? How would you take care of your loved ones? Now, most especially if they are being infected with the COVID-19 virus. No, it was a really challenging times for us. So due to increased transmissibility of the SARS-CoV-2 Omicron variant, to enhance protection for healthcare personnel, patients, and visitors, and to address concerns about potential impacts on the healthcare system given a surge in COVID-19 infection. So infection control recommendation for healthcare personnel during COVID-19 pandemic, which is also applicable to us now when we have patients to be taken care of inside our homes, inside a home healthcare setting. So empiric use of transmission-based precaution, that is very important. Not to do quarantine, to isolate ourselves or to isolate our loved ones or our patient is recommended for patients and all of us who have had close contact with someone with SARS-CoV-2 infection, if they are not up to date, if they don't have yet the knowledge with all recommended COVID-19 vaccine doses. So generally, quarantine is not needed for asymptomatic based on the new guidelines that was presented by the World Health Organization and the CDC, who are up to date with all recommended COVID-19 vaccine doses, or who have recovered from COVID-19 infection in the prior of 90 days, also 3 months. So it's very important that we healthcare professionals, we nurses, knows how to use, how to don and doff personal protective equipment. No, that's why our Ministry of Health, our Department of Health, really encourage nursing leaders to guide the young nurses on how to don, on how to doff, or how to use or how to use those personal protective equipments in order to protect themselves, in order to protect ourselves from having that infection. So ensure proper use, handling, and implementation of personal protective equipment. That is the most important. Now, before we don't know how to disinfect ourselves, we are trying to use this chlorine. Now we're trying to use this between the idea of using isopropyl from ethyl alcohol. Now we have many researches been popping out in Wikipedia, in Google, regarding that COVID-19 management because of the fear that we may lose our loved ones or ourselves. Now we need to know how to use and when to dispose certain personal protective equipment. The goggles, the face shield, the medical cap, surgical mask, N95 mask, shoe cover, leg cover, disposable cover, and the alcohol and all your overall PPE that will cover yourself, and it falls into level 4 protection. Now, when you are really taking care of a COVID-19 confirmed patient. So with that, you are going to use that PPE and with the proper disposal also. I know the fact, most especially Asia, because we are in the country with less supplies to arrive than compared to US, to China, to other big countries. Now, with the first surge of the pandemic, I know we Asians, now most especially in Indonesia, Philippines, India, tried to innovate. You know, nurses are very innovative. We are very resilient, even we are in the emotion of fear. No, I myself tried that plastic trash bag. I created it in order to cover myself with a plaster, with a tape, no, in order to be protected. And I know the kind of comfort that we feel when we are using those close PPE. It's like we are dying in hell with all that the hotness that we feel when we are wearing that overall PPE. It was a very challenging because, you know, with my age, I'm already 34, and with, you know, a little bit of hypertension already. Now with the what's this, with the thing that I'm wearing, no, it's very difficult for me to move, to run, not to run a code because it's very a full gear. No, we cannot barely breathe properly because we are using N95 masks and those, you know, in the market that we can buy those industrial masks and then cover it with another, you know, surgical mask, not double mask. If you shout a code, maybe your colleague cannot hear you. No, I have an experience. I was in ER and then I saw an old man died already. Okay, I tried to do my CPR and all in the open environment. Then I shout for a code, but nobody hear me because I am in full PPE. I need to leave the dead body, okay, just to show to the family that you are really helping the patient. Even the patient died already. I know the fact that the patient has died already, maybe 10 minutes or 15 minutes. No, it's just very fast because of the inflammatory markers that's being, you know, racing up crazily. No, and the laboratory is not that, you know, fast in releasing their result because, you know, many people needs the inflammatory markers and all of those things. So when I saw it and then I shout for code, nobody helped me, nobody hear me. No, so I need to go out and leave the body, no, in order to call for assistance. No, maybe we can still save, no, the patient. So it is a very challenging for us. So yes, no, this caricature drawing, now we can see that we are doing the standard PPE, the full PPE, and the enhanced PPE. So as infection control nurses, we really need to learn this. Even you are a nurse working as a freelance, okay, because the industry now, okay, being a nurse, you should not only be seen yourself working inside the hospital. I'm a registered nurse. So in my life, I am just working in the hospital. No, no. We nurses have a lot of functions in the community also. Now, I myself work as a freelance home care nurse for 4 years in order to sustain my study. When I enrolled in my master's degree, I know, I'm enrolled in a private school, and I know it's very expensive, no, to pay with my own education. Now, because when during the time it was 2010, when you decide to apply in a hospital, for us in the Philippines, I will just share my experience. I need to pay in order to serve the hospital, in order to gain that experience, that clinical experience being a registered nurse. Okay? So I don't want that. Okay? I don't want to spend my own money for the training because I am already a registered nurse, and for me it is an insult. No? So that's why I decided, no, and I cannot also support my education. How can I support my education? I cannot receive any peso, no, or any ringgit in that situation. So I need to work as a private nurse, a home care nurse, as a freelance, okay, bringing my own theories, ideas, no, and my confidence, because you don't know what kind of patient you are working. Okay, I am advertising myself that I really gave my confidence in that time because I am really inspired, no, to gain income being a registered nurse. I was not tempted. No, I was not tempted to go to a BPO company to work as a call center agent, okay, to work in a clinical processing outsource, not to receive that salary. I don't have any job aside from nursing. So I decided to work as a home care nurse. No, I visited different hospitals, giving flyers of myself that I am rendering that one. And time comes after 1 year of doing that, I made my own business. I made my own business as a home care, no, home care nursing agency. Okay, I hired my own RNs, no, registered nurses. I hired my own caregiver and nursing aides and distribute to different houses here in my place in Cebu City. No? So meaning we are not only working, no, in the hospital, but we can be out of the box in our profession. We can be young leaders in your own, no, in your own hard work. No, I cannot imagine that I created a business like that. No, at the young age, at the age of think I'm 26 that time. So I've made a nursing home, no, agency that provided nurses to stay at home 8 to 12 hours, no, taking care of patients with mechanical ventilator. I need to do my blood transfusion, no, in the home, in their home, because I have Chinese patient who are very rich. When you go inside their room, it looks like a ICU already. They have all the equipment. I experienced patient like that. I even experienced traveling patient from an island to island, or even traveling from Philippines to Singapore just to, look for treatment for his lung cancer. So I was really having that joy. No, I enjoy working as a home healthcare nurse that time while I am doing my master's degree. That's why I decided to take my major, to take my specialization in medical surgical, because I want to enhance more my education. I want to enhance more my critical thinking. Whatever patient that I have on my hand, I know how to take care of them. I know how to deliver the nursing management towards my patient. So we are not only thinking that we can work in the hospital or we can work as a teacher if you have your master's degree, but also we can work as a nurse entrepreneur. Now, we should be confident that we can be nurse entrepreneur also. Now, learn the business industry. I know when I sit the first day of my nursing school, no, I don't have any subject related to business. I only have nursing mathematics. I only have nursing statistics, but I was not introduced to the business world. That's why I am encouraging now young nurses of today's generation to be aware, to take part in knowing what is entrepreneurship, what is business, because you yourself can be empowered to become a businessman, a business nurse, no, a businessman, and then you are a nurse. No? So we need to see the world that we nurses are also empowered. No? We can run a hospital, we can run our own business, we can teach, and we can be specialized in our field. No? That time will come that we Asian countries, if I'm not mistaken, no, the Philippines don't have yet that kind of nurse practitioner program. But our law, our nursing law, is trying to push that nursing practice program. I know in Singapore, they have already nurses that will have their NPs. No? I hope that Indonesia also will also promote specialization for nurses, because nurses is not only so-called general, no, or general nurses. No, I saw when I was working in Saudi Arabia, when you graduated Bachelor of Science in Nursing, it might be 4 years or it might be 3 years depending on your curriculum. We Filipinos and Indonesian will receive the title of general nurses. No, we work as general nurses on those time. But now the Saudi Commission, the health minister in Saudi Arabia, now released that kind of leveling of nurses. Now we can be specialists after 2 years working in the said field. If you want to be a nurse midwife, if you want to be a medical surgical nurse, so we should have a specialty on ourselves. We cannot be master of all. No, we cannot be working all sides of the nursing practice. Okay, but with all specialization that we have, this infection control and prevention is always in us. It is already innate if you are a healthcare professional, if you are a nurse. No, we should always implement this one. This is the basic of providing safety to our patient. When I take my NCLEX exam, I took up NCLEX in the state of New York. All of my questions, it was last year, June 25. Most of my questions are related to infection control. No? Community health nursing. Those are the topics that I was answering. And I'm a major of medical surgical. No? So I just put on myself, focus on the question, that trying to act that I am a community health nurse, knowing that infection control and prevention, the chain of infection. No? So alhamdulillah, I passed the exam. So every nursing exam that you have, a nurse is really capable to answer that. Because anatomy and physiology cannot be another anatomy and physiology in Indonesia. Okay, a brain is a brain on top. No, it is superior in our body. So what is nursing in US and what is nursing in UK, we might be differ by the laws and the implementation of our policies, but we are all the same. We are nurses. The procedures is the same. If there are any innovations because of research, that is the time we need to implement that one. If it is really clinically proven that it will give a benefit, than harm to our patient, right? So nursing in home care settings, because this is also my experience working. When I was hired, at the age of 26, I was just a very young nurse. When I was hired being a registered nurse serving home care settings, I feel like it's like that I am a household maid. It's like that I am assistant only to the family. But I changed my mind and I keep myself to the fact of positivity. I keep myself being positive that I am a registered nurse, and I separate myself of being a professional nurse compared to the household maids, because I have patients who are very rich. No, how can they pay me if they are just normally income person? Of course, my patients are well off in life because they can afford to pay a registered nurse to have 3 shifts, no, in a day, no, just to take care of their loved ones, their elderlies, no. I have nurses who are working as a wound care nurse. I have nurses who are very expert in mechanical ventilation. I have nurses who are very expert in peritoneal dialysis, no, who was trained in Fresenius company in dialysis. So the pay is really expensive. It's very extravagant to hire a nurse with specialized skill. That's why it's very important. No, I think for me during my time, a simple nasogastric tube that I insert, I think I can be paid I think 1,000 pesos. So that would be equivalent to how much? Like 50, $50. So it's really big money for me in my time. So how much more today? No, with the threat of the COVID-19 virus. You are a nurse. You are being called. Can you serve my grandmother? She is sick. Can you assess? Can you come here? So being a RN, we are very good in health assessment. Even without the presence of a medical doctor, because we are trained to do our health assessment, we know that the patient are what? Have a problem on this, have a problem on that, and we can priority things when to refer to a medical doctor. No? So we can give our primary care to our patient while they are still at home. But if you don't know how to do that, to give that strategy, how can you serve the community? Now, are you just thinking of yourself? Now, 10 years from now, you are still working in the hospital? Now, are you not thinking of yourself that 10 years from now, after having my experience like me, after 10 years of having that clinical experience, na, after finishing my doctorate degree, I am now focusing on nursing education because I want to be the nurse educator that I am already trained. I saw the international standard. I saw the local standard. So that's why I am pushing myself to educate and to train and to take nursing exam, because I believe that learning is a continuous process. Even you are already a PhD in nursing, even you have doctorate degrees, but still our knowledge is a continuous process. Most especially we are dealing with life. No? So that is the important. And as an educator now, as a nursing educator, I am always telling this to my young student nurses because I am teaching first year nursing students. This is where I can build their foundation in nursing practice. This is where I can develop their nursing ethics. No? I am always showing them the reality of nursing profession in our country and in the international arena, because I don't want them when they become registered nurses, they will cry. No, they will cry when they are assigned in ER. They will cry when they are assigned in ICU. I remember my staff nurses. I said, okay, I am understaffed now. I don't have anyone from my ER. So I need to pull out some nursing staff from my ward area, from my ward area, my medical ward. So I pulled out one nurse. Okay. And she cried in front of me because she was not trained. She was not yet exposed in emergency nursing. I said our hospital is infirmary hospital. We are not receiving terrible cases here, and we can manage this. No, can you see the difference between the nursing day, those nursing days? No, like maybe I can be I can range it with during my time, no, and now, no, and the time of nursing now. That for me, when I graduated my BSN, I have my license already to practice nursing. I am very dedicated. Okay, every patient that comes into the ER, I need to attend this one. I need to know how to manage this patient. No? Because I am very curious. I am very eager to learn on how to save lives. Now, those are the things I am now teaching, and I am now pushing to the young nurses, for our future nurses. No, they experience pandemic. Okay, they are into online nursing now when it comes to lecture. They are in modules. So how would you be sure that these nurses knows what is the principle of infection control? Okay, how do they take care of their loved ones, their family, and the public if they don't know the basic principles of infection control? Huh? So before we set into this nursing in home care settings, we need to be what? We need to know the principles of infection control in order to deliver our services towards our clientele in the public level. Because when you are a home care nurse, you're already serving the public. You're working as a public health nurse because it is your responsibility, it is your own critical thinking and stance that you decide by yourself in order to provide safety, to provide the right nursing care, not the treatment, because doctors do that. But whatever the doctors order, we ourselves can guarantee that we can provide that to our patient. Okay? So to understand, because you know what is nursing home? No, okay, let's read this from coming from a theory. A nursing home, also referred to as a skilled nursing facility, is a long-term care services facility that provides housing to your loved one. In addition to housekeeping and nursing services, if your loved one needs ongoing medical care, there are licensed nurses and nursing aides available to them 24/7. So there's a business on that. No, if you are rich, no, if you have that capacity to build a nursing home, if it is accepted in your country, okay, because here in my place in Cebu City, Philippines, we have already a nursing home provided for our elderlies, now with families who are, you know, well off in life, and they can provide to pay home nursing services. Now, a nursing home is a useful option for those who are healthy enough to live not the hospital but are unable to care for themselves and their home. Because we have not all family are the same. Even how rich you are in life, even how many kids you have, no, there's such a time in your life as a parent, or you have seen this in a life situation, that a parent is abandoned. So how would you protect those abandoned parents, abandoned grandmother, grandfather, no, to be protected by the government? No, we need to take care. Okay, according to Dr. Joel Akub, he is very expert in elderly care. That is his field. No, and then Miss Wang for the wound management. No, you are all facing this kind of um, elderlies, no, with wound, and how can you manage it? Because you cannot just simply use your hands and clean the wound. We need a barrier. We need to know the basics of the infection control, no, in order that we will not be contracted of some of the what's this? Some of the super bugs like the MRSA, no, the methicillin resistant Staphylococcus aureus. If you have that, it's very, very popular in Saudi Arabia. Once you have a patient who is going to OR, now you need to swab all the nose, the throat, the armpit, the groin, and even the anus, no, to check if they are positive with this MRSA. Because once this MRSA be with us, no, healthcare professional, how would you care for a surgical patient? Now, this is a super bug. It cannot be easily been killed by any antibiotic. No, it needs a thorough management. That's why I question and ask the guidance also of Miss Wang if in Korea they're using the chlorhexidine body wash for patients who are positive with MRSA. No, because this is very important that we need to know how to manage this patient, no, to wear that standard precaution of infection when we go to our patient. No, it's okay if you are a nurse working in the hospital, you are well provided. But how about a patient who is positive for MRSA, who is recovering from a post-bypass heart surgery and then going home? Okay, how would you know to care a patient with positive of MRSA if you don't know? Now, what if the family will call? My father is sick. He's having a fever of 38.5 degrees Celsius post-bypass. Okay. If you don't know, no, if you don't know to assess, to ask for history, no, if the patient is already positive with MRSA and you just suddenly touch the patient, okay, even you do hand washing and you touch your patient with bare hands without wearing the gloves, so would that MRSA bacteria will go to your skin and spread it to the community? Now, so we should know how to manage it, because if you are planning to go abroad and you are positive with MRSA, you cannot be assigned in a surgical area. Now, most of my Saudi nurses, okay, who are positive with MRSA, I know some of you there, my brothers and sisters who have experience working in Saudi Arabia, you cannot work in a surgical area or even in the clinical bedside care. Okay, most especially for those vulnerable, now with patients with weak immune system. No? For those patients who are for those nurses who are positive with MRSA, they will be placed in the nursing administration. They will do the paperworks, okay, and continue with their lifetime with this chlorhexidine body wash. Okay, that's why I'm very afraid. Now, when the Ministry of Health asks all of the nurses, where is the swab test for all of the nurses in your hospital? They need to check if all the nurses in my hospital before that I'm working are all MRSA negative. No? Because they're trying to get the names of those nurses, and they will be placed, they will not be sent home, okay, as expats. They will be placed in a working position where they are just doing paperworks. No, in their side they have their chlorhexidine, it's like alcohol also, and they are provided with this chlorhexidine body wash, no, in order to limit the growth of MRSA. And every 3 months, if they completed their shower, body shower, they will be undergoing this swab again. Now, can you see how infection control practices, infection control and prevention practices is very important for us nurses? We are not only protecting ourselves, we are not only protecting our patient, but we are protecting also our family, our loved ones, and the community. Okay? So that is the theory of nursing home. Okay? So what is home care? Now, home care is exactly what it sounds like. Now, care provided to you in the comfort of your own home, depending on the level of care your loved one needs or the capacity of the family to provide those medical equipments. Because sometimes also I have a family member who is very well off, is very rich. They can provide a mechanical ventilator. If they want to buy, they can have mechanical ventilator. No? If they want a cardiac monitor, they can provide a cardiac monitor inside the patient room. No? So it's like a hospital. It's like a mini ICU. All the things are there, but the patient is in their house with the on-call doctor, with the 3 shift nurses and a 3 nursing aide. How was that? No? Most of my patients are Chinese. Most of the Asian family. Now, they don't want that their elderlies, that their mama and papa, baba and mama will be placed in a nursing facility, in a nursing home facility. No, where you cannot see and check the condition of your mama and baba. No? So we are very close family ties. No? Not like the Western countries, no, and some part of the European countries that they give more time for their work because they are not they are really tied up with their work because of the expenditures, no, the expenses that they have in their country, and the need to work in order to survive in their country. No, it's a different. That's why I'm also telling my nurses, if you want to work in USA, if you want to work in London, no, in UK, and you are earning this one and this one, but if you continue your education and develop yourself towards nursing practice, if you want to make a business, be in the nursing practice, as a nurse entrepreneur, your income for this will be what? Will be a level on the income in your own country. Now, if you know how to strategize, if you know how to, what's this? To make a living. That's why I was not tempted. I was not encouraged to work in London, in UK, because the income that nurses are earning there are, for me, I'm earning also here in my country. So why do I need to go there and pay my taxes and all? Yes, they have life, they are good, but for me, I rather choose to be near with my family. If I want to go to any country, to Western or European countries, I want to become a visitor. I want to become a tourist, not as working also. No? No, because when you are there, I have my friends, Filipino friends, who are working in UK and in America. When they arrive in the land of the free, they were thrown to the COVID unit. All of the Filipinos, if you are new, okay, you will be thrown to the COVID unit. And all those Americans, black or white or any, they are there in the nursing administration. They are your nursing supervisor, nurse managers. They're working different works. And you can, mostly of the hospitals there, you will see Asian working in the bedside. Okay? Even I have my friend who gained PhD degree in nursing. When he went there, he start all over again. Okay? Because the board of nursing will not let him practice first. Will let him serve for 2 years upon the contract before he can be free to, what's this? To work. And then the employers now are manipulating all of the promises just to have you in their agency. The third party now, the outsource of nurses are also business. Why not Philippines will outsource other nurses from other country? Why not Indonesia will hire some nurses from other country? That's why it's my dream that nurses will not be brain drained, because there is money in nursing in our homeland. It's just a fame, a sense of liberty, where you are also be democratic and be free in your own country together with your family. I know we have our own different lives, but this is also one of the principles that I am also telling to my student nurses. We are not just taking up nursing because we want to go to America. We want to go to London, to meet the Queen. But we are doing nursing because this is our profession. This is a dedicated work of God. This is for humanity. And that is the most important of nursing. So people who are aware at risk of COVID-19 infection, we all know older adults, elderlies are very prone for the infection, any kind of infection, not only COVID-19. Now in Asia, we are very high cases of tuberculosis. There are still the stigma. Now, if you have a tuberculosis, you're afraid to go to the clinic or hospital to seek for treatment, even it is free, because you are afraid to be discriminated. There's still a stigma on that. Even my mother got tuberculosis, and I encourage her to enroll herself because it's free from the government. She is afraid. She is shy. She wants to make it a secret And me, okay, I follow my mom. So as a nurse, I know what's the treatment and all. So I have my private doctor and I am managing it by myself in our house. And now, alhamdulillah, my mother is okay with that infection. So it's very important to know how to take care in every diseases and every pandemic that we have. Still, the basics and the principles of infection control practices will be always the same. Now, remember the flu, the first flu, no, the black flu that they're telling, no, the first pandemic. Still, the infection control practices will never change. The basic of infection control and prevention will never be changed. It's still the same. No? Hand hygiene, no? Doing hand washing, the very common, no? The very least expensive. No? So we all know this, older adults already. No? I know, I am very confident that you know all of these things because you're already nurses. No? So medical conditions, the comorbidities, no, it will depend. No, if you are a nurse taking care of patients with cancer, chronic kidney disease, and all of these medical conditions that being screened to you, you should know how to prevent or to protect yourself from having that infection or protecting your patient, because your patient, most of these patients are immunocompromised. No, you need to teach their family members not to make kiss them directly. No, you don't know that they have tuberculosis and they are not yet treated, and all of the diseases. So what will happen? So I know in Indonesia you have different culture, ethnic, and practices. Now when it comes to the giving, what's this? Giving death services to your loved ones. No, I saw it in CNN or in National Geographic Channel that you have different ways of sending your loved ones to rest. No, I saw different culture in Indonesia. Some are preserving them like mummies, no, and then some are getting them, putting them clothes on. Some islands in Indonesia are doing that. Okay, because you are not only an Islamic country, but you are a diverse country with a lot of religions, beliefs, and practices. No, so the cultural aspect and the principle of nursing is also in you, just like us Philippines. So I understand you have also inculcated the culture in your nursing practice. So children and teens, no, for children and teenagers, no, that's why we started now. Are you starting in Indonesia, vaccinating 5 years old to 11 years old? Vaccinating with this COVID-19 vaccine? Have you started the program already promoting this to 5 years old to 11 years old and above? No, because here we are already starting, but not all will, will do it as abrupt as now, because, as human as we are, we need to observe first, because we have seen, me, myself, no, with 2 years, and now I have only seen minimal cases of COVID-19 infection to children. I have the youngest, 6 months old, and a newborn, but there's no like symptoms of having difficulty of breathing or something, pneumonia, no? Because we know the pathology of the COVID-19, that they are really good, no, in sticking themselves to the presence of the angiotensin converting enzymes that were commonly found in our throat, no, to get inside to our cells, replicate. But these young, no, newborns, the toddlers, no, their immune system is in newborns, it's not yet developed, but when they reach toddler, they're starting to develop. So there's a minimal symptoms that will be felt by our toddlers, but most of them survive the infection. So that's why people are starting to question, no, and observing. So we cannot also, what's this, push or ourselves also, if we have nephew, nieces, sons and daughters. No, it's not that easy for us to push because we need to observe, just like what happens now. No, after 2 years of promoting vaccination, or 1 year and a half, and now people are complaining, where's the vaccine? Why there is no schedule for booster dose? Because they have seen that vaccine works for adults, but for these children, no, we need to count the statistics first, observe. So it's normal for us human being. So being a nurse, no, implementing infection control and practices, implementing or pushing vaccination, I would choose to educate first the community when it comes to infection prevention and control. That's the most important first, before I will introduce the theory of vaccination. Because if they know how to protect themselves, the infection will not scatter that rapidly, because they know how to do social distancing, they know how to wear or what kind of face mask that they're going to use, no? How to boost their immune system with the vitamins, no? How to protect themselves. And what's the difference between a flu and a COVID-19 virus infection, for God's sake? No? Because people will not believe for COVID-19 because they said that is just a modern way of naming the flu, no? Which is flu is different, no? Commonly adenovirus, no? But this COVID-19 is coming from a SARS-CoV family, no? So nursing advices to patients. Okay, what you advise as a nurse, it is important to protect yourself and others by taking preventive measures against COVID-19. Step up to date with your COVID-19 vaccine. Wear a well-fitting mask. Avoid crowds and poorly ventilated spaces. Test to prevent the spread to others. Wash your hands often. Cover coughs and sneezes is very important. Monitor your health daily. Okay. Help with basic needs. Okay. Support. We need to make sure the person who is sick drinks a lot of fluids and rests. Help the person who is sick follow their doctor's instructions for care and medicine. Okay. For most people, symptoms to few days, and people usually feel better after a week. See if over-the-counter medicines for fever help the person feel better. Okay, because there's also contraindications for this and limitations when you are taking antipyretic drugs. Okay, make sure the person who is sick drinks a lot of fluids and rest. Help them with grocery shoppings or something with the new innovation now of, orders, online orders. No, take care of their pets also because they're one of the carriers also. Dog can contract COVID-19. No, limit contact with the person who is sick with their pets, because if we are petting them, okay, it might cause the transmission of infection. Watch for warning signs. Now, have their doctor's phone number on hand. If you are a home healthcare nurse practitioner, if you're practicing home care nursing, so you should have all the mobile numbers, telephone numbers, emergency numbers at your phone or in your pocket, because that is the way you can help or you can seek help in managing your patient. When to seek emergency medical attention: trouble breathing, persistent pain or pressure in the chest, new confusion, inability to take or stay awake, pale gray or blue colored skin, lack of oxygenation, the signs of lack of oxygenation. So this list is not all possible symptoms. Okay, please, we need to call the physician immediately. Caregivers should quarantine if you're exposed or if you are contracted with the COVID-19 infections or other infections, most especially airborne infections. So caregivers, anyone who has been in close contact with someone who has COVID-19 or other infections should stay home except in limited circumstances. When it's safe for a person who has been sick to be around others, then eat in separate rooms or areas, most especially with COVID and tuberculosis. Avoid sharing personal items. Clean your hands often. Test to prevent spread to others. Clean surfaces regularly. Track your own health. Now, if they cannot track, we as healthcare professionals should monitor, most especially the weight, not the diet of our patient. Okay, we need to boost their immune system. So we need to give them a good diet. Now, if the COVID-19 community level where you live is what? Low, medium, high. So in Philippines, we have our leveling also. We are categorizing it to a mild, moderate, critical level. So in order to what's this, to categorize our patient according to our Philippine health insurance also, because our country will also covered if you are admitted with confirmed COVID-19 infection. Okay, so the person who is sick, so usually if sick, so the person should wear what, mask, no? When they're around other people, home or out, including before they enter or in the doctor's office, if they visit for consultations or checkup. The mask help prevent a person who is sick from spreading the virus to others. It keeps respiratory droplets contained from reaching other people. Okay, if your patient is rich enough, you can let them buy a HEPA filter, a air purifier. Okay, we have lots now in our hardwares and department stores. Air purifier. No, we have LG or any air purifier, or the HEPA filter machine or equipment. No, we are putting now that in our facilities, in our healthcare facilities. Okay, for healthcare provider, so we need to put on mask also, wear the PPE properly, no, avoid contact with sick person, blood or stool or any fluids, bodily fluids, no, throw our PPEs and dispose it properly. Now, always look for the yellow bag, sign of infection. You need to properly dispose your PPEs in a designated or in a assigned area, because that is a hazardous also to the public. Practice everyday preventive actions to keep from getting sick. Wash your hands. That's the most important. Wash your hands, sanitize, and hands off, meaning avoid touching your eyes, your nose, your mouth when you are not doing your hand hygiene. Okay, everyone, to my brothers and sisters in Indonesia, Shukran Katir. Thank you for listening.
Thanks a lot, Mr. John, for your very detailed information about how to prevent ourselves from the infection. And for other audience, you can give your question to the chat box. I am waiting for your question, please. Okay, while waiting the question, can I ask one question, Doc?
Yes, sir.
Actually, in Indonesia, usually people get vaccine twice, and this is the new vaccine. So people in Indonesia get in vaccine 3 times.
Okay, with a booster shot.
The question is, how if someone only get in vaccine only one vaccine, what happened to their body? Is one vaccine is not enough to prevent the virus?
Okay, so we all know the theory of vaccine. Okay, this vaccine is taken from a virus, a COVID-19 virus. It is weakened through the process of some vaccines, the mRNA, messenger RNA, through the process of mRNA. So it will train our body, it will activate our immune system, our WBCs, to create that antibodies against from COVID-19 infection. It is better than nothing. Okay? If the government takes time, because we experienced that. Like for me, example, I received my Sinovac COVID-19 vaccine. And it took me it's like supposed to be, I should be vaccinated like for 6 weeks. Then after 6 weeks, I should receive my second dose. But what happened? It reached 3 months before I received the second dose of the Sinovac vaccine. No? But still, even though your immune system is trained, Now, when I check my antigen markers, it's not yet that high, but at least your body already create now that antibodies to protect yourself. So because in my country, I don't know in Indonesia if you are already um, doing the vaccine by private institution or where you can buy, but for us it's not yet happening. We are not yet able to purchase our COVID-19 vaccine via private pharmaceutical companies or pharmaceutical drug in the hospitals. We cannot buy that one. We will wait for the government that the vaccine will come and will receive it if there's a schedule. So with the effort of our government, no, for those people who receive one dose only and it took them for 6 months, in my village, some of the people received the second dose for 6 months. But it limits the transmission of COVID-19 because when you are living in the village, people also is not crowded, okay? Not like other cities. So being a public health practitioner, you need to prioritize those places with many population. Like for example, in the cities. Okay. In public health, we need to prioritize also, not only in the hospital. We need to do triaging in the hospital, and also we need to set our priorities like doing our triaging in the cities. Okay. Which one with priority to be provided with the vaccine? No? It should be the city because more people in the city are living. If common people in the city are vaccinated even in one dose, this will limit like for 10% of transmission of the COVID-19 infection. So meaning there is a good effect. There's a good effect for that. Okay. But if you are fortunate enough that the government is really doing its best for a timely scheduled vaccine, so we all say alhamdulillah for that opportunity that you are facing. But still, it's an issue in my country, most especially in the village, in some islands, that people are not yet given second dose. But can you see now the effect of those people, even you receive one dose only, second dose or a booster shot, with these statistics that I've read in Google now, March 11, no? 583 cases all over the Philippines now, no? Not like before. So meaning there is a curve in the COVID-19 infection. That's why the Department of Health, the ATF, us, no, directed us to be in the level 1 of protection. So I think it's better. For me, in my side, it's better you receive the dose than you have not received any vaccine. The question, I've also seen questions.
Okay. Okay, thank you for the answer. And there is a question, Doc.
Okay, sir. This last time, when the number of COVID was higher, member of relative asked for help for saline infusion. The patient already is 70 plus years old, chronic diabetic, consume insulin, not routine took daily. They refuse for antigen COVID tests. On the other hand, okay, also I don't have any hazmat standard precaution for patient. It's such dilemma, sir. For that case, how can we handle? Now, how can we handle, for example, case of, okay, we have the same. Now we have the same dilemma. I have also the same dilemma as you. Because my hospital is not, provided with all the hazmat for that. So it is fearful. But as a healthcare professional, as a nurse, what is the most important way of protecting yourself? What is the mode of transmission of COVID-19 virus? Okay. Now it's airborne, droplet. You even include droplet precautions and the airborne precautions. So meaning you need to prioritize as much as possible, implement that barrier, okay, implement that face mask, and even comes the time that we should wear our face shield in order to protect, in order to have that barrier, okay, just to limit the transmission of the COVID-19 infection. You don't have any hazmat. What we did, we create our own hazmat. We buy some plastic, laminated plastic, and we created, not through innovation, we created our own face shield, because it was the time that medical equipments and materials are running out of stock. So how can I protect my nurses? How can I manage my nurses as a chief nurse on that time, and encourage the hospital administration to purchase medical materials for us to protect ourselves, like the hazmat. So while waiting for the order of the said materials, the PPE, we will not stop our service in taking care of our patient. We should continue. But as nurses, we are very innovative. So we come out into plan that even the trash plastic bag, we are cutting it and wrapping it to ourselves. You know, if we have really seen the infection or the signs and symptoms, you are really having that COVID-19 infection. So we are trying to wrap ourselves with those plastic bags, the trash bags, and making sure that we are wearing N95 masks. And it reached to a moment that every single N95 mask, we need to keep it for 3 days before we dispose it. You know, how was terrible is that? I am so fearful to have that infection, because I need to keep air dry, spray with alcohol my N95 mask, and air dry it for 24 hours and use it again for tomorrow. Because the N95 mask is limited on that, in that surge. So what we did, we need to cover with the surgical mask first. We need to put plasters in our faces and our chin in order to seal it properly before we put our N95 mask, and then to protect the N95 mask for having it getting dirt or exposed to the outside portion, we need to cover it again with another surgical mask. And then before we put on our goggle and our face shield, in order to save that N95 mask. No? As healthcare professional, yes, we are afraid. We have the fear of having that virus because we might die. Even we have colleagues, we have nurses who are very fortunate to have that hazmat, but still they die. They still contracted the virus. Okay? Because we don't know, they're exhausted. Okay? So their immune system is being down already because they don't have enough rest and sleep because of the long duty hours. So what you will do? So we need to adapt. We need to be resilient. We need to be positive and create innovation. That's why year 2019, 2020, 2021, they call it year of a nurse and a midwife. That is the most challenging year for us. I don't know, is it a coincidence that they declare the year of the nurse and a midwife and having the challenge of facing a pandemic? Okay? Can you imagine declaring for a year of a nurse and a midwife, and together there's a pandemic that brings challenge to all healthcare professionals around the world? No? We have all dilemmas and experiences. But my answer to that, we need to be positive. We need to be creative. We need to know the mode of transmission, the portal of entry of the COVID-19 virus, or any kind of infection. It might be bacterial, fungal, parasitic, or what's this? Viruses, right? Correct me if I'm wrong. We should go back to the basic. We should know the chain of infection. No, where is the host, the portal of entry, the portal of exit? No, how to break the infection. So I hope I answer your question, Sister Hesty. So the next question, is there possibilities for the virus develop new type of virus? Yes, that is we call the variation of virus. No, we are now in Omicron variant. But because we are vaccinated, the effects of Omicron is not the same, the effect that is being seen by the Delta variant. Because now in the Philippines, for example, or Indonesia, I will say 100% and you have 65% of your population is being vaccinated. So meaning the curve will be lessened because your body is trained already. It's being your body is producing already antibodies against the COVID-19 viruses. So meaning your population, your community is being protected already with the infection. So in fact, this virus is not disappearing, only reduced. Yes, viruses are long time ago. No? Why do we need to vaccinate ourselves annually with the flu vaccine? Because virus are mutating. Virus survived long time ago, maybe the time that Allah make the world, maybe Allah also make the virus. No? We don't know that one. Same as human beings. No, if you believe to Charles Darwin, no, the theory of human development that we are coming from apes, if you believe that one, can you imagine? From an ape to a human, how much a virus? From a single cell virus, maybe for a Omicron variant virus, no, from one single eye to an 8-eye virus. So it's growing, it's creating a new variant, and even it is creating a new variant, still the basic of infection prevention and control is still the same. If we will just study, not through science, because before, when that COVID-19 virus arise and before it declares to be a pandemic, we don't know how to manage that one. We don't know, even the WHO and the CDC have a debate if that is airborne or that is a contact precaution. But for me, I need to be what? I need to double myself. I need to consider it as airborne and a contact precaution and a droplet precaution. Because once you talk, you are not covering, you are not wearing mask, the droplet will stay in your skin, you touch it. So it's a contact, it's a droplet, and it's an airborne. No? So the same. Next question. And the time, my day for... Yeah, congratulations. You're already married. Kumusta? Hello, Sister Dia. Kumusta, Dr. Jem? I'm amazed with your background. Could you please share some tips and tricks to get RN so we can work in other country? Oh, I am encouraging nurses to stay in their country. I am promoting nurses, and the government should give importance, should give security, tenuity for their nurses in their own country. In order, they will not be encouraged to go abroad to work. Okay? But if there is an opportunity for you, you know where to take the exam. You know where to take the English exam. You know where to take the NCLEX for America exam, the OSCE for UK. So nurses are very innovative. Now we all know, and we know the tricks where to look for that exam. Now I myself, I graduated 10 years ago. Then I decided to review for NCLEX exam. Okay. With all confidence, alhamdulillah, I passed one time only. Now, even in the peak of the pandemic, okay, I was still working as a chief nurse, night and day. But alhamdulillah, even my time for review for myself is very small and minimal, very controlled. But I always stick to my basic principles of nursing practice. And the confidence of being a nurse. So that's the only key. You will pass the international nursing exam. Okay, my brothers and sisters, if you dream, I cannot stop you, but always continue to learn. Okay, if you found more money in America or more money in London, try also to be to educate yourself. No, we are already finished with our BSN program. After BSN, you proceed for masters. Okay, you look for schools or universities that will be comparable curriculum. Okay, like for example, in Philippines, my master's degree in nursing is comparable with the master's degree of nursing in USA. Okay, and my PhD or my doctorate is comparable with the PhD in USA. So it's up to you. I need to work. really hard. Okay, I need to work night and day in order to sustain my education because it's really tough. Okay, we have some state universities, colleges and universities here, but it's very difficult to enroll yourself if you will not pass the entrance exam. And I cannot do that focus myself because I have many work. I need money in order to support my family and myself. So I decided to enroll in a private university. But with all that hard work and effort, nurses, remember this. Along your effort and hard work, there will be success waiting for you along the road. Just persevere. Okay. No? Just first persevere.
Okay. Thanks, Doc, for your answer. I think this is the last question. And
thank you, sir.
Can you give your message or your motivational word to the nursery in Indonesia to end this to end this presentation?
My motivational message to my brothers and sisters to Indonesia. Okay, this is my message to you. Keep on dreaming. Keep educating yourself because education is power. That is the way in order to show the people, in order to show the world that the world really needs nurses. The world needs nurses with specialty. Okay? We're not just simply nurses working on a bedside. We can also be specialized of something in order to help more sick people, no, to give more our care to the sick people or to the well people. Education is the key for us in order to represent ourselves, no, in the nursing industry, to hear our voices. Okay, not only our clinical practice, but we should always do it with enhancing our nursing education. Okay, because that is based on my experience. I gain credibility, I gain my power, no, in teaching nursing after I finish, no, after finish for 3 years after finishing my doctorate degree. Okay, that's why I'm focused now in nursing education because I want to motivate young nurses, okay, to be responsible of their profession, to show to the young nurses that nursing is a profession of care, not a profession of extravagance and lucrative acts. Because you are earning, you can go to USA, you can go to London. So if there is an opportunity that the government is offering, if there is a nurse who is very concerned with the nursing in situation, now fighting for the rights of the nurses in Indonesia, go support your association. Go support the Indonesia Association of Nurses. Support your mother organization. And you will create a nursing law. Okay, just like us in Philippines, we are fighting for that nursing law in order to level up the education of the nurses, that the nurses should be given opportunity to excel their specialty and go and reach the goal of having that degree of being a nurse practitioner.
Okay.
Okay.
Thanks
Yes.
a lot
Thank
for your
you.
motivation. Okay, Dr. Jennifer Ariano, I think this is the last forum from us as the PPNI Kabupaten Tulungagung. And if you have any mistake, we say sorry to you. And we give a very lot of thank you to you. And see you again, Doc.
Inshallah. Inshallah.
Inshallah. See you again. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Oke. Selanjutnya untuk peserta dimohon untuk standby. Saya selaku moderator mohon maaf yang sebesar-besarnya apabila terdapat hal-hal yang kurang berkenan dalam membawakan acara pada pagi ini. Acara selanjutnya saya serahkan kepada MC.
Baik, masih semangat untuk Bapak Ibu? Untuk itu yang acara yang terakhir yaitu penyampaian buku sekaligus penyampaian door prize. Jadi nanti untuk Bapak Ibu yang beruntung dan nanti jangan, mohon maaf, jadi nanti untuk Bapak Ibu yang beruntung nanti bisa menghubungi panitia. Baik, untuk itu kita penyampaian buku, daftar buku dari organisasi PPNI. Dari untuk, mohon maaf, untuk panitia bisa menampilkan PPT daftar buku keperawatan. Buku ini orisinil dari PPNI. Untuk pemesanan nanti bisa menghubungi admin, nanti akan saya tampilkan admin 1 dan admin 2. Buku ini sangat bermanfaat untuk Bapak Ibu, terutama yang membuka praktek perawatan mandiri. Baik, untuk seminar yang hari ketiga, jangan lupa besok join melalui Zoom pada jam 7 pagi. Untuk link Zoom-nya sama. Bagaimana untuk Bapak Ibu, apa masih semangat?
Masih, Bu.
Ya. Ini saya share screen daftar buku keperawatan original dari PPNI. Nah, dari sini, dari beberapa buku ini sangat bermanfaat karena ada beberapa ya, seperti SOP, kemudian kode etik. Setelah itu ada juga untuk pedoman praktek keperawatan mandiri. Mungkin ini standar prosedur operasional keperawatan. Buku ini yang berisikan langkah-langkah dalam melakukan asuhan keperawatan. Jadi untuk yang Bapak Ibu mendirikan praktek keperawatan mandiri, bisa diorder buku ini asli dari PPNI. Next. Kemudian buku yang kedua yaitu pedoman perilaku sebagai penjabaran kode etik keperawatan. Nah, kode etik keperawatan ini tidak asing bagi kita teman sejawat karena kita menjunjung tinggi kode etik keperawatan. Nah, di dalam sini sudah dijabarkan. Tentunya buku ini terbaru yang dikeluarkan oleh PPNI. Next, bisa lanjut. Buku yang ketiga yaitu pedoman penyelesaian sengketa etik keperawatan. Nah, buku ini berisikan bagaimana cara arahan penyelesaian berkaitan dengan sengketa etik. Sengketa etik keperawatan baik pada pelayanan maupun di dalam kehidupan profesi. Nah, dari daftar-daftar buku ini nanti jika ada yang mau ditanyakan atau mau order nanti bisa melalui admin 1 dan admin 2 nanti akan saya tampilkan di akhir slide. Kemudian lanjut di buku yang keempat yaitu pedoman praktek keperawatan mandiri. Buku ini tentang langkah-langkah untuk perawat profesional dalam membangun praktek keperawatan mandiri. Di dalam ini sudah ada aturan atau bagaimana cara untuk memperoleh SIPP, kemudian format yang ada di sini untuk rujukan dan lain-lainnya. Jadi untuk Bapak Ibu nanti yang ingin order nanti bisa di admin 1 dan admin 2. Untuk admin 1 087 862 191 711. Untuk admin 2 085 748 011877. Mungkin itu, jika nanti ada yang ditanyakan terkait daftar isi, bisa menghubungi admin 1 maupun admin 2. Baik, terima kasih. Kemudian, acara yang terakhir yaitu pembagian door prize. Jadi mungkin ini banyak Bapak Ibu yang ditunggu-tunggu. Nah, jadi untuk nanti pembagian door prize-nya, siapa yang beruntung, nanti bisa screenshot, kemudian dikirimkan ke panitia masing-masing. Dan untuk pemenang, nanti ongkos kirimnya pengiriman ditanggung oleh pemenang.
Gratis.
Ini lupa sama siapa, Mi?
Kenapa?
Lupa sama siapa?
Abi.
Untuk All Jatim nanti gratis. Baik, Bapak Ibu bisa kita mulai. Mungkin dari panitia bisa mutar. Kita sambil tunggu. Jangan lupa untuk berdoa, semoga beruntung. Ya, Ibu Hanif, mohon maaf, Bapak Hanif Fatoni, mungkin masih bergabung di dalam Zoom? Mungkin masih bergabung di dalam Zoom? Iya, mungkin beliaunya sedang keluar atau di mana ya. Lanjut lagi untuk pemenang selanjutnya. Selamat kepada Ibu Fenty Kusuma Ika Wulandari, AMD Keperawatan. Mungkin masih bergabung bisa menyapa. Ibu Fenty Kusuma Ika Wulandari. Mungkin masih bergabung di dalam Zoom. Iya, kita lanjut saja ya untuk pemenang yang ketiga. Ya, stop. Siapa yang menang? Selamat kepada Ibu Dwi Krisna Aromsari, AMK. Kemungkinan masih bergabung di dalam Zoom. Jangan lupa untuk men-screenshot, kemudian dikirimkan ke panitia. Halo, untuk Ibu Dwi Krisna, mungkin masih bergabung? Nggak ada. Iya, kita lanjut. Kita lanjut, siapa yang beruntung untuk kali ini? Selamat kepada Ibu Nurse Desi Aryani. Mungkin masih bergabung di dalam Zoom, bisa menyapa.
Alhamdulillah, terima kasih Bu.
Ya, terima kasih. Ya, jangan lupa untuk di screenshot ya, kemudian nanti dikirimkan ke panitia. Iya. Nanti bisa dikirimkan alamat ke panitia. Kita lanjut lagi. Siapa yang beruntung kali ini? Ya, kita tunggu. Ya, Pak. Selamat kepada Ibu Sri Tuti Handayani. Mungkin masih bergabung di dalam Zoom. Silakan untuk menyapa. Ibu Sri Tuti Handayani kemungkinan masih bergabung di dalam Zoom. Baik, kita lanjut lagi. Yang keenam, siapa yang beruntung? Selamat kepada Ibu Kusnul Khotimah. Jangan lupa untuk di screenshot dan kemungkinan masih bergabung. Ya, kemungkinan sudah live dari Zoom.
Halo, ya Ibu.
Ya, selamat atas menang Ibu Kusnul Khotimah. Jangan lupa untuk screenshot dan nanti disampaikan oleh panitia.
Oh iya, terima kasih Bu.
Ya, selamat kepada Ibu Feti Hirmawati. Mungkin masih bergabung di Zoom dan menyapa. Iya, selamat. Jangan lupa untuk di screenshot. Ya. Mungkin iya, selamat Ibu. Mungkin iya. Mungkin bisa lanjut. Baik, selamat kepada Ibu Emri Rani Aristia, Sarjana mohon maaf, AMD Keperawatan. Mungkin masih bergabung di dalam Zoom. Silakan untuk menyapa. Iya. Ya, untuk door prize selanjutnya, mungkin dari Bapak Ibu ingin mereview materi, nanti akan mendapatkan door prize dan gratis. Dan gratis untuk Jatim. Silakan untuk Bapak Ibu. Silakan untuk Bapak Ibu yang ingin mereview materi yang sudah disampaikan oleh narasumber kita. Baik, untuk Bapak Ibu ingin menyampaikan terkait HUT atau menyapa, silakan untuk on kamera dan on mikrofon. Silakan untuk Bapak Ibu. Nanti akan mendapatkan free door prize dari panitia. Masih semangat semuanya?
Masih, Bu.
Iya, kemungkinan dari Bapak Ibu yang ingin menyapa.
Masih sangat semangat.
Masih, Bu.
Ya, kemungkinan dari Bapak Ibu yang ingin memberikan atau mengucapkan HUT PPNI yang ke-48 tahun atau ingin mereview materi yang telah disampaikan. Mungkin bisa raise hand.
Boleh, saya Mbak.
Ya. Dengan Ibu.
Ya, perkenalkan nama.
Ya, dengan siapa? Ya, dipersilakan Ibu untuk on kamera.
Saya on.
Iya, Ibu Dia Kusnul Khotimah.
Iya. Kameranya sudah on belum? Sudah ya?
Mohon maaf belum. Ya, silakan untuk di-on-kan kamera. Halo? Pak mungkin terputus?
Iya, mungkin nggak usah kamera on juga nggak apa-apa ya?
Iya, tidak apa-apa, Bu.
Oke. Terima kasih sebelumnya untuk kesempatan yang diberikan. Saya dari Rumah Sakit Columbia Asia Semarang. Saya ingin mengucapkan selamat untuk PPNI yang dari Kabupaten Tulungagung yang berulang tahun 48 tahun sebelumnya. Untuk materi hari ini luar biasa ya materinya, yang dimulai dari NPWT sampai ke gerontik, bahkan sampai ke infection control, itu adalah masalah-masalah yang real kita hadapi saat ini. Jadi penanganan luka mau di berbagai lini itu pasti akan dibutuhkan, dan prosedurnya, manajemennya itu juga sangat amat update ya. Terus untuk keperawatan gerontik yang sepertinya memang belum maksimal untuk dilakukan di Indonesia sendiri, baik itu secara mandiri ataupun di semacam kayak keperawatan gerontik di panti jompo juga belum maksimal untuk peran perawatnya, tapi itu termasuk ada ilmu barulah yang didapatkan dari seminar ini. Selain itu untuk motivasi-motivasi yang diberikan Dr. John tadi juga luar biasa sekali. Dan infection control itu kita sebenarnya prinsipnya adalah precaution-nya atau pencegahannya, yang mana kadang perawat itu suka menggampangkan. Contoh hal simple yang sering kita lupakan adalah 5 moment hand hygiene. Itu adalah hal yang sudah harusnya melekat dan otomatis refleks, tapi kebanyakan rata-rata setelah dari pasien itu hand hygiene, tapi sebelum atau saat setelah tidak kontak dengan ruangan atau hanya cairan saja jarang gitu. Jadi precaution-nya itu termasuk yang perlu ditekankan lagi sih untuk kedepannya, dan dengan pemberian materi hari ini termasuknya ya sungguh amat luar biasa, mengingatkan kita semua. Sekian, terima kasih. Terima kasih sudah.
Baik, terima kasih kepada Ibu Kusnul atas kesannya. Mungkin ada satu kesempatan lagi bisa untuk raise hand. Mungkin Bapak Ibu ingin menyampaikan pesan atau selamat ulang tahun kepada PPNI, bisa raise hand. Masih semangat semua? Mohon maaf, mungkin terkendala sinyal, suaranya terputus-putus. Baik, jika ingin menyampaikan pesan, nanti bisa raise hand dan mengaktifkan kamera serta mikrofon. Baik, Ibu Eli. Atau Bapak Ari Dwi Wardayani.
Selamat siang.
Ya,
Salam buat teman-teman sejawat di seluruh Indonesia. Selamat HUT PPNI yang ke-48. Semoga profesi kita semakin jaya dan semakin hebat. Jaya, jaya, jaya. Salam sehat, salam sejahtera.
Terima kasih Bu Ari atas semangat kita untuk PPNI yang tahun 48 tahun. Ya, nanti bisa menghubungi panitia ya, Bu.
Baik, terima kasih.
Baik, untuk yang terakhir, pemenang yang terakhir nanti kita akan seleksi penanya yang terbaik dari yang kemarin. Untuk pengumuman nanti akan disampaikan besok ke seminar hari ketiga. Jadi untuk seminar hari yang ketiga, besok melalui Zoom, dan untuk link Zoom-nya nanti sama seperti yang sekarang. Untuk jadwalnya jam 7 pagi. Ya, saya akhiri. Mohon maaf apabila ada salah kata. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam.
Terima kasih.
Terima kasih.
Terima kasih.
Untuk materinya hari ini.
Ibu, absensinya yang kedua ada ndak?
Iya, mohon maaf untuk absensinya hanya 1 kali, dan untuk materi webinarnya nanti bisa di-download di www.onphc.com. Nanti akan diupload setelah seminar.
Baik, terima kasih.
Oke, terima kasih Bu.
Sama-sama. Mohon izin lah.
Baik, terima kasih Bu. Terima kasih Bu.
Terima kasih Kakak. Terima kasih dan selamat siang. Sampai jumpa besok pagi.
Semangat.
Terik matahari yang cerah memberikan kehangatan pada pagi hari ini. 2 tahun sudah kami bergelut dengan pandemi COVID-19. Sebagai perawat, kami terus mengabdi dalam percepatan penanggulangan pandemi COVID-19 ini. Dengan penuh harap dan asa, selalu memberikan pelayanan terbaik dalam andil menjaga dan meningkatkan kesehatan masyarakat. Tanpa lelah, kami selalu memberikan contoh dan mengedukasi untuk selalu patuh protokol kesehatan kepada masyarakat. Dengan penuh harap dan asa, selalu memberikan pelayanan terbaik dalam andil menjaga dan meningkatkan kesehatan masyarakat. Tanpa lelah, kami selalu memberikan contoh dan mengedukasi untuk selalu patuh protokol kesehatan kepada masyarakat.
Konfirmasi COVID-19 positif. sebanyak 609 orang. Totalnya menjadi 27.549 orang.
Kita semua pasti sepakat tahun 2020 banyak sekali hal baru yang terjadi
Melindungi
secara tidak
diri
terduga,
dari resiko tinggi
baik
penularan.
suka ataupun duka.
Karena
Hal yang
kami
paling
ingat,
berdampak
ada
lahir ketika
keluarga yang
COVID-19
menunggu kami
menjelma menjadi pandemi.
untuk pulang dengan selamat.
Perputaran keuangan mendadak berhenti. Tempat favorit kita tergempar sepi. Untuk pertama kalinya, dengan berjauhan, kita saling menjaga, meski harus menunda jutaan rencana.
Selamat ulang tahun PPNI yang ke-48. Bersama kita bisa. Yes, yes. PPNI ke-48. Bersama lawan COVID-19. Bangga merawat bangsa. PPNI yang ke-48. Bersama kita bisa. Merawat puskesmas kedatangan. Oke, oke. PPNI yang ke-48. Bersama kita bisa.
PPNI yang ke-48 bersama kita bisa.
PPNI yang ke-48 bersama kita bisa. Dan selalu bisa bermanfaat bagi masyarakat dan
Tahun 2019, kita masih merasakan kenyamanan. Dan tahun-tahun sebelumnya, kita bisa menghirup udara bebas. Kini semuanya berubah.
Dua warga Indonesia yang positif terinfeksi virus corona dinyatakan melakukan kontak dengan warga negaranya tersebut warga wilayah Jawa Barat menjalani proses karantina selama 3 hari. Berikut ini timeline perjalanan bagaimana warga Jakarta datang ke Indonesia.
Pada seluruh rakyat Indonesia, kita minta tetap tenang, tidak panik. Dengan kondisi ini, saatnya kita kerja dari rumah, belajar dari rumah, ibadah di rumah.
Konfirmasi COVID-19 positif sebanyak 609 orang. Totalnya menjadi 27.549 orang.
Kita semua pasti sepakat tahun 2020 banyak sekali hal baru yang terjadi secara tidak terduga, baik suka ataupun duka. Hal yang paling berdampak lahir ketika COVID-19 menjelma menjadi pandemi. Perputaran keuangan mendadak berhenti. Tempat favorit kita tergempar sepi. Untuk pertama kalinya, dengan berjauhan, kita saling menjaga, meski harus menunda jutaan rencana.
Bersama kita bisa. Yes, yes. PPNI ke-48 bersama lawan COVID-19 bangga merawat bangsa. PPNI yang ke-48 bersama kita bisa. Perawat puskesmas sedotangan. Oke. PPNI yang ke-48
Bersama kita bisa. Memberikan kehangatan pada pagi hari ini. 2 tahun sudah kami bergelut dengan pandemi COVID-19.
terinfeksi virus corona dalam melakukan kontak dengan warga negaranya tersebut warga wilayah Jawa Barat menjalani proses karantina selama 14 hari. Berikut ini adalah timeline perjalanan bagaimana warga yang akan datang ke Indonesia.
Pada seluruh rakyat Indonesia, kita minta tetap tenang, tidak panik. Dengan kondisi ini, saatnya kita kerja dari rumah, belajar dari rumah, ibadah di rumah. Konfirmasi COVID-19 positif sebanyak 609 orang. Totalnya menjadi 27.549 orang.
Kita semua pasti sepakat. Tahun 2020, banyak sekali hal baru yang terjadi secara tidak terduga. Baik suka ataupun duka, hal yang paling berdampak lahir ketika COVID-19 menjelma menjadi pandemi. Perputaran keuangan mendadak berhenti. Tempat favorit kita tergempar sepi. Untuk pertama kalinya, dengan berjauhan, kita saling menjaga, meski harus menunda jutaan rencana.
Bersama kita bisa. Yes, yes. PPNI ke-48 bersama lawan COVID-19 bangga merawat bangsa. PPNI yang ke-48 bersama kita bisa. Perawat Puskesmas Rejo Tangan. Oke, oke. PPNI yang ke-48 bersama kita bisa.
PPNI yang ke-48 bersama kita bisa.
PPNI yang ke-48 bersama kita bisa. Semoga selalu bisa bermanfaat bagi masyarakat terutama di Kabupaten Tulungagung.
Pagi ini begitu cerah dan indah. Namun pandemi COVID ini menjadikannya tidak begitu berarti. COVID-19 membuatku gelisah. Peran apa yang bisa aku berikan untuk menghentikan pandemik ini?
Kabupaten Tulung Agung di daerah selatan adalah berbatasan dengan pesisir pantai. Salah satunya adalah Pantai Joko yang merupakan wilayah kerja Puskesmas Besole di wilayah Dinas Kesehatan Kabupaten Tulung Agung.
Perguruan tinggi sebagai agen intelek menumbuhkan semangat untuk mengabdi.
Sebagian besar warga di pantai Indah Popong adalah sebagian nelayan. Kehidupan mereka sehari-hari dia bisa di laut untuk mencari ikan.
Vaksinasi yang telah diprogramkan pemerintah harus turut kita dorong. Hari ini aku ayunkan kakiku menuju pesisir.
Pandemi COVID-19 memberikan banyak pelajaran bagi kita, yang menuntut kita untuk senantiasa waspada, untuk senantiasa kita selalu bekerja sama dalam mengatasi pandemi ini. Kehadiran perguruan tinggi sebagai agen intelektual saat ini tengah diuji kehadirannya, kontribusi nyatanya dalam menghentikan penularan COVID-19.
Penduduk di Pantai Indah Popong ini atau di Dusun Popong ini sekitar 1.000 sampai 2.000 orang. Sebagian besar penduduk di Dusun Popong ini masih banyak yang belum melakukan vaksinasi. Dikarenakan mereka takut akan divaksin dan mereka belum menerima informasi yang sebenarnya.
Banyak hal kujumpai di sana. Masyarakatnya, suasananya, budayanya, dan banyak hal lain yang engkau dapatkan di pesisir. Hujan tak menyurutkan semangat kami.
Stikes Utama Abdi Husada Tulung Agung berkomitmen untuk berkontribusi secara nyata dan ikut serta dalam upaya memutus rantai penularan COVID-19 di Kabupaten Tulung Agung.
Segala cara telah dilakukan untuk menghentikan pandemik ini. Vaksinasi adalah upaya terbaik yang saat ini ada. Mensukseskan vaksinasi adalah kewajiban kita bersama.
Sehingga kita perlu upaya yang lebih kerjasama yang lebih lagi dalam semua pihak agar mereka semua mau ikut vaksin.
Semoga dengan kegiatan pengabdian masyarakat ini kita dapat merubah perilaku masyarakat pesisir untuk mereka sadar vaksin dan dapat merubah perilaku dengan budaya kehidupan baru dengan penerapan protokol kesehatan dalam kehidupan sehari-hari.
Semoga pengabdian ini memberikan dampak nyata, menjadikan masyarakat sehat, dan pandemik berakhir. Semua kembali bahagia.
Terik matahari yang cerah memberikan kehangatan pada pagi hari ini. 2 tahun sudah kami bergelut dengan pandemi COVID-19. Sebagai perawat, kami terus mengabdi dalam percepatan penanggulangan pandemi COVID-19 ini. Dengan penuh harap dan asa, selalu memberikan pelayanan terbaik dalam andil menjaga dan meningkatkan kesehatan masyarakat. Tanpa lelah, kami selalu memberikan contoh dan mengedukasi untuk selalu patuh protokol kesehatan kepada masyarakat. Melindungi diri dari resiko tinggi penularan. Karena kami ingat, ada keluarga yang menunggu kami untuk pulang dengan selamat. Memberikan edukasi untuk selalu menerapkan pola hidup sehat. Mengkonsumsi buah dan sayur, rutin olahraga sesuai kemampuan, dan tetap patuh protokol kesehatan untuk membantu memerangi pandemi. Kami ikut andil dalam pelaksanaan vaksinasi COVID-19 untuk negeri. Karena mensukseskan vaksinasi adalah tugas kita bersama untuk negara. Pelaksanaan testing, tracing, dan treatment sebagai upaya memutus rantai penularan COVID-19 terus kami laksanakan. Terus berinovasi dalam memberikan pelayanan kepada masyarakat untuk memudahkan dalam mendapatkan pelayanan kesehatan. Semoga pengabdian ini memberikan manfaat untuk sesama, menjadikan masyarakat sehat, dan pandemi segera berakhir. Semua kupersembahkan untukmu, PPNI dan Indonesiaku.
Pandemi COVID-19 belum berakhir. Jangan kendor, tetap patuhi protokol kesehatan. Dengan 5M, tangan, pakai masker, menjaga jarak, membatasi mobilitas, menjauhi kerumunan. Partisipasi aktif dalam pencapaian vaksinasi COVID-19. Bersama kita bergandeng tangan untuk menyelesaikan pandemi. Kami perawat Puskesmas Pagar mengucapkan selamat hari ulang tahun PPNI ke-4. Perawat bersama rakyat.
Mengadakan program vaksinasi yang mana merupakan salah satu bentuk pengabdian kami kepada masyarakat umum, yaitu sebagai perawat menuju bangsa sehat bebas COVID-19. Dalam rangka mencegah penularan COVID-19, kita wajib tetap melakukan penerapan protokol kesehatan, diantaranya yaitu 1. Mencuci tangan sebelum dan sudah melakukan tindakan.
Stop, pastikan dulu tanganmu bersih.
Ya, terima kasih. 2. Memakai masker secara benar. 3. Menjaga jarak minimal 1 meter. Kami dari DPK Rumah Sakit
Assalamualaikum warahmatullahi wabarakatuh. Saya Surhardi Eskapnes Mkes selaku Kabid Yanmed Rumah Sakit Putra Waspada mengucapkan selamat ulang tahun PPNI yang ke-48. Semoga perawat Indonesia lebih baik dan tangguh dalam memberi pelayanan kepada masyarakat. Perawat bersama rakyat menuju bangsa yang kuat. Wassalamualaikum warahmatullahi wabarakatuh.
Saya, Dr. Inggit Puspitasari Adikarjo, selaku Direktur Rumah Sakit Putra Waspada, mengucapkan selamat hari ulang tahun PPNI yang ke-48. Semoga semakin baik dalam memberikan pelayanan dengan berbasis mutu dan keselamatan pasien. Perawat bersama rakyat menuju bangsa sehat. Terima kasih.
Persatuan Perawat Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam artikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk mengantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Perawat majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, capai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu, serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia. Majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugasmu.
2019, kita masih merasakan kenyamanan. Dan tahun-tahun sebelumnya, kita bisa menghirup udara bebas. Kini semuanya berubah.
2 warga Indonesia yang positif terinfeksi virus corona dinyatakan melakukan kontak dengan warga negara yang sakit COVID-19 di wilayah Jawa Barat. Menjalani proses karantina skala Covid. Berikut ini adalah timeline perjalanan bagaimana warga yang akan datang ke Indonesia.
Kepada seluruh rakyat Indonesia, saya minta tetap tenang, tidak panik. Dengan kondisi ini, saatnya kita kerja dari rumah, belajar dari rumah, ibadah di rumah.
Konfirmasi COVID-19 positif sebanyak 609 orang. Totalnya menjadi 27.549 orang.